ચાલવાનું નહીં કે હજી ડબલ થવા દે ને આ છે ને તો ડબલ થાય પછી ચાલશે એ પણ તને કાંઈ ઊંચાઈ કરતો ને એની તો હવે કેમ ટેરેસમાં નથી જતો હે આ તો રાતના સાંજના જવાનું ને આ લોકો આ બાજુ આવે તો ઓલી બાજુ પડી જવાનું ને ખાલી પડી આખી ટેરેસ આજે જજે
Hello. Sir, ma'am, it has started live streaming. Ma'am, Rupali
Good afternoon, everyone.
अच्छा ठीक है. And it has started live streaming now. Yes, yes. Because he told वो बहुत. मैम मैं वही चेक कर रही थी. I just completed 1 second पहले ही ये सब प्रोसेस. मैम नहीं होगा वो. Because that is very complex. I don't know how to do. मैम लक्ष्मी मैम का ये आ रहा है. हाँ चलेगा. दैट वन कैन डू. ठीक है चलेगा. बाय. यस सर. हाँ 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 किया. ओपन एस जाम. बहुत जल्दी कर. अबे यार सर माय लैप. ખુદ બખુદ કેમ જાય છે સ્લીપ ઉપર.
તું છે આમાં હજી પણ મીટિંગ એ આસુ વેન્ટ થઈ ગઈ ધ વિડીયો કોલ એન્ડેડ
અહીંયા છે અહીંયા.
તારું આમાં દેખાય
હા તો આ મારું લાઈવ સ્ટ્રીમ થઈ રહ્યું છે.
દેખાય છે હા જલ્દી ખા જલ્દી ખા
સ્ટ્રીમ સારા ચાલે છે.
થઈ ગયું
હવે આ લોકો જે કરશે.
થઈ ગયું બચી ગયું તો પછી એવું
तुम्हारो आना अंदर आना। हाँ सर, मेरा नाम रिद्धि है। यस यस सर, मेरा है ना सब कुछ दिख रहा है, व्हाट्सएप एंड वो सब। तो अभी मैं वापस आ गई, अभी क्या करूँ? हाँ सर, ऑटोमेटिकली वो दिख रहा है, लाइव दिख रहा है। मेरा स्लीप पे चला गया था, पता नहीं गलती से। पर ओके ठीक है, हिला रहा है। अरे सर, पर मेरा है ना ये अभी यूट्यूब पे दिख रहा है ना, तो मेरा दिख रहा है इधर कि हाँ गूगल मीट पे हूँ। किया फर्स्ट इज वाइट बोर्ड, चेंज लेआउट, फुल स्क्रीन, चेंज लेआउट किया। अभी है ऑटो, टाइटल, स्पॉटलाइट एंड स्लाइड बार। टाइड एक टाइड, हाँ, जिसमें 6-7 लोग ऐसा साथ में दिखते हैं। ठीक है, पर हाँ किया। ओके सर, इसमें टाइल 16 कौन सा, कितना टाइल रखूँ? 4 ही रखो ना? 16 इतना सारा लो? हाँ 16 ही है। ठीक है चलेगा, तो अभी कैंसिल कर दो क्योंकि सब लोग को दिख रहा है ना। ठीक है चलेगा। एंड मैं सर फुल स्क्रीन कर दूँ क्योंकि उसमें म्यूट एंड ऑडियो मेरा सभी ये दिख रहा है। ऐसा कुछ नहीं ना, चल ठीक है। हाँ चलेगा, ऑल राइट। थैंक यू सर सो मच, बाय। ले सोचो क्यों जाएंगे ले तो। શું આવ્યું બોડી શેપ ચોકલેટ લેવા આને કોઈ ટચ નહીં કરતો। તે મીટિંગ હોસ્ટ કરી છે।
મીટિંગ હોસ્ટ નહીં, એની તો લાઈવ સ્ટ્રીમિંગ કરે છે
શું
યુટ્યુબ પર। કેટલા જણાથી ખબર?
અહીંયા બાદ છે કેમ કે આ મેનેજમેન્ટને જ ખાલી છે।
યુટ્યુબ ઉપર 12 લે।
યસ ક્યાંથી? ઓહો, કેવી રીતે? ઓકે ઓકે, આઈ એમ સોરી, આઈ જસ્ટ ચેક। સ્ક્રીનશોટ કરીને
શું થયું?
તારા છે પણ બોલો કે આનંદ જાય हेलो यस मैम, yes ma'am, I'm checking back only. I cut हाँ गई। किधर है? हाँ
Ma'am, you are muted. Yeah. So, welcome everybody for today's webinar. Good afternoon to one and all present over here. I, Dr. Rupali Sangupta, coordinator of postgraduate diploma in sports science, fitness and nutrition, welcome you all for today's webinar on management of nutrition in sports personnel during pandemics. Before we start, I kindly request our principal, is she there? Ma'am is there online? I'm not able to see her. I think ma'am is busy. Our principal, Professor Dr. Mala Pandurang, who has always been a great support in organizing all such webinars for us. We also have with us today our Vice Principal, Mrs. Anuradha Shekhar. I would also like to welcome ma'am to address the gatherings for today. Welcome, Anu ma'am.
So hello everyone, and I am very happy to see the kind of webinar that the Department of Postgraduate Diploma in Sports Science and Fitness Nutrition has organized today. It's indeed a real. I'm really happy to know that Namrata ma'am from Sports Authority of India has joined today, and she's going to be sharing her insights in whatever good work that the Sports Authority of India does. And in India, sports nutrition is still in its infancy, and I'm sure many of you would really benefit from the kind of thought processes today that we are going to generate from these two wonderful young lady who's also joined from NIN. So I'm really looking forward to hearing from you. So Namrata ma'am, thank you for accepting our invitation and being here. And we are looking forward to your deliberations. Thank you very much, Rupali, and all the team members here. And even Korean from NIN. I think I had met you once when I had come to NIN. So we're very glad to see you here today amongst us and have a nice deliberations today. Thank you so much.
Thank you, Anu ma'am, for the wonderful talk. I would also like to welcome my dear students who has been my great strength for organizing any event, may it be a small on a larger scale. They had always supported us as a department together. They came forward and they have organized the entire event, even for today's webinar. To understand the in-depth of today's webinar, we have with us Miss Shushmita Joshi. I think ma'am is using Namrata Gulati's platform to use for today's talk due to the technical glitch on her end, who is the Regional Director of Sports Authority of India, Mumbai. I thank you, ma'am, for accepting our invitation, and we are very glad today to have you with us for today's event. Pandemic has hit the world, and because of the spread of the disease and the lockdown, there has been a major drift in the daily activities and the entire lifestyle for many individuals. We must have heard about the guidelines of many populations, different group of population, I mean to say, such as the geriatric population, pregnant women, people who are suffering from the non-communicable diseases. But today we have gathered here to learn how to nutritionally manage this pandemic situation for the sports persons. So it is my great pleasure to introduce today's first speaker, Ms. Shushmita Joshi, Regional Director, Mumbai Division. Ma'am is presently working as a regional director in Sports Authority of India, Mumbai. She has 31 years of experience in government services. She was the head of delegation of Indian gymnastics team for World Championship in 2013. She is the senior national medal winner in gymnastics, has done her master's in physical education. She has done several diploma and certificate courses like sports coaching and gymnastics from National Institute of Sports, sports management, international certificate course in aerobics, rhythmic gymnastics, and sports medicine. Now I request Madam to take over the session. I request Bhabisha Madam to just share the slide.
मैं नमस्कार करती हूँ सभी को, और डॉक्टर BMN कॉलेज के प्रिंसिपल को और वाइस प्रिंसिपल को और रूपाली सेन गुप्ता जी को मेरे तरफ से बहुत तहे दिल से बहुत बहुत धन्यवाद, क्योंकि मेरे को यही बात के लिए आपको विशेष रूप से स्पोर्ट्स फ्रेटर्निटी की तरफ से धन्यवाद करती हूँ कि स्पोर्ट्स की न्यूट्रिशन के बारे में, स्पोर्ट्स के बारे में जो अदर एजुकेशनल इंस्टीट्यूशंस थे या है वो बहुत ज्यादा नहीं सोचते थे। मैं थोड़ा सा पीछे जाती हूँ, जो 80 शतक की बात है, 70 शतक की बात है, या 2000 सन में भी इतना स्पोर्ट्स के बारे में लोगों को अवेयरनेस नहीं था, और जनरल पब्लिक जो है वो स्पोर्ट्स के लिए बहुत ज्यादा सोचते नहीं थे, ध्यान नहीं देते थे। तो अभी मैं देख रही हूँ कि न्यूट्रिशन की तरफ से न्यूट्रिशन जो ऑर्गेनाइजेशंस है वो हमारे पास आते हैं, पूछते हैं, हमारे प्लेयर्स को कंट्रीब्यूट करना चाहते हैं उन लोगों के डेवलपमेंट के लिए। और मैं हमारे जो डायरेक्टर जनरल है हमारे संदीप प्रधान जी, उनकी जो फोरसाइटेडनेस है हमारे प्लेयर्स के लिए, उनके लिए मैं तहे दिल से उनको धन्यवाद करती हूँ, जिन्होंने सबसे बड़ी बात है कि न्यूट्रिशनिस्ट को स्पोर्ट्स अथॉरिटी ऑफ इंडिया में अपॉइंटमेंट दी हुई है। मुझे लगता है ये बहुत बड़ी एक माइलस्टोन है जो न्यूट्रिशन डिपार्टमेंट और जो लोग न्यूट्रिशन की डेवलपमेंट के लिए, स्पोर्ट्स डेवलपमेंट के लिए कोशिश कर रहे हैं, उन लोगों के लिए एक बहुत बड़ी बात है, जो कि इसका स्पोर्ट्स डिपार्टमेंट में इनका जॉब पहले नहीं था और वो जॉब प्रोस्पेक्ट बनाया गया है। और इसकी पॉपुलैरिटी साई क्योंकि अभी अडॉप्ट कर रहे हैं और न्यूट्रिशनिस्ट को जॉब दे रहे हैं, न्यूट्रिशनिस्ट को, जो बाकी जो अदर प्राइवेट ऑर्गेनाइजेशंस है उन लोग भी अवेयर ऑफ हो रहे हैं और इस बात को आगे बढ़ा रहे हैं। तो मुझे लगता है ये एक बहुत बड़ी बात है जो आप लोग जो ये कदम लिए हैं, इस कदम के लिए पूरे स्पोर्ट्स फ्रेटर्निटी आप लोगों की तरफ जिंदगी भर आभारी रहेगा। और न्यूट्रिशन आप सभी लोगों को पता है कि एक फ्यूल है, पर हम खेल ही खेलते थे, हम फ्यूल के बारे में कभी सोचा ही नहीं। मैं एक स्पोर्ट्स एडमिनिस्ट्रेटर हूँ, कोच की तरफ से और न्यूट्रिशनिस्ट की तरफ से और डॉक्टर्स की तरफ से जो इनपुट्स हमारे पास आए थे उसके हिसाब से ही हम ये पेंडेमिक में हम बच्चे लोगों को उसके हिसाब से हम मैनेज किए। हमारा आज का टॉपिक है न्यूट्रिशन मैनेजमेंट एंड ट्रेनिंग ऑन इन हाउस एथलीट्स ड्यूरिंग द पेंडेमिक। ये बहुत चैलेंजिंग सिचुएशन था और मगर बाद में जब हम इसको इम्प्लीमेंट करने गए तो जितना डिफिकल्ट हमको महसूस हो रहा था उतना डिफिकल्ट हमको नहीं लगा, क्योंकि सभी लोगों का ध्यान जो है इसकी तरफ ही था कि हम साई की तरफ से कैसे उन लोग बच्चों के साथ कोऑर्डिनेट करें। तो पहले ही जब पेंडेमिक शुरू हुआ वो महीना था हमारा मार्च का एंड, और जो क्रूशियल पीरियड था मार्च एंड और अप्रैल का हमारा बहुत ज्यादा क्रूशियल पीरियड था। उसमें से क्या होता है, जो हर साल का हमारा जो प्रोग्राम था वो प्रोग्राम में मार्च महीने में बच्चे लोग स्कूल में से एग्जामिनेशन के बाद अप्रैल महीने तक वो घर पे चले जाते थे और कुछ बच्चे जो एग्जामिनेशन के लिए तो रहते थे। तो उसी के चलते हम लोगों का ऐसा हुआ कि कुछ बच्चे जो ऑलरेडी फरवरी एंड में चले ही गए थे घर पर उनकी डेट शीट के हिसाब से, और कुछ बच्चे हमारे एथलीट यहाँ रह गए थे। बाद में जब डिक्लेरेशन हुआ तो कुछ बच्चे जो थे वो हमारे पास रह गए थे। तो हमारा जो डिवीजन हुआ वो दो हिस्से में बट गया। हमारे जो प्लेयर्स थे कुछ घर पे रहे, कुछ हमारे सेंटर में रहे। तो हमको दोनों तरीके से हमको इस बात को मैनेज करना पड़ा। उस मैनेजमेंट के चलते हमको एक नया बात का हमारा जो एक्सपीरियंस हुआ ये है कि हम बहुत बच्चे लोगों के नजदीक आ गए। ये पेंडेमिक के चलते हम लोगों को बहुत स्ट्रेस है, टेंशन है, हम सोचते हैं हम बंद हो गए, मगर एक बात उभर कर आई है कि हम लोगों को जितना इंटरपर्सनल रिलेशनशिप आज बच्चों के साथ हुआ, बच्चों के पेरेंट्स के साथ हुआ, वो कभी भी नहीं था। बच्चे लोगों को हम घर भेज देते थे, उसके बाद बच्चे लोग पेरेंट्स के पास चले जाते थे, वो अपने में हम अपने में। मगर इस बार क्या हुआ, घर चले जाने के बावजूद भी हम उन लोगों के साथ जुड़े रहे और उनके पेरेंट्स के साथ भी हम इंटरेक्शन पे रहे। मुझे लगता है ये बहुत बड़ी माइलस्टोन हम लोगों ने हासिल किया और मुझे लगता है हमारा स्पोर्ट्स डिपार्टमेंट नहीं, सारे डिपार्टमेंट इस बात को बहुत तारीफ कर रहे हैं और जिस हिसाब से सारे लोग जुड़े हुए हैं इस जूम के माध्यम से, गूगल के माध्यम से, तो ये बहुत बड़ा एक अचीवमेंट है। और पहला जो हमने ग्रुप बना लिए थे, हमारे पास 4 डिसिप्लिन है, 4 डिसिप्लिन में से एक एथलेटिक्स है, एक रेसलिंग है, कबड्डी है और हॉकी है। ये 4 डिसिप्लिन के बच्चे लोग हमारे पास पहले थे और इन 4 डिसिप्लिन के बच्चे लोगों का हम एक मोबाइल में एक ग्रुप बना लिए थे ताकि हम इंटरेक्शन कर पाए। और बहुत सारे बच्चे लोगों का बहुत हाई रेजोल्यूशन वाला मोबाइल किसी के पास है, किसी के पास नहीं है, तो इसलिए ग्रुप बना लिए थे। तो जो भी हम लोग का प्लानिंग होता था वो प्लानिंग को हम उन लोगों के साथ शेयर करते थे। तो हम लोगों का एक प्रोसीजर फॉलो किया गया था पेंडेमिक से पहले, जो ये बंद होने से पहले ही। तो हम लोग न्यूट्रिशन असेसमेंट हर बच्चे को, हमारे इधर जो भी बच्चे थे उन लोगों को हमने न्यूट्रिशन असेसमेंट किया था। उसके बाद हम उन लोगों का ब्लड टेस्टिंग एथलेट्स को हम करके रखे थे न्यूट्रिशन पॉइंट ऑफ व्यू से, हम किस बच्चे में क्या कमी है, क्या डिफिशियंसीज है, उसके साथ उनका वाटर लॉस कैसा है ड्यूरिंग ट्रेनिंग से बिफोर हम उसका वजन लेते थे और ट्रेनिंग के बाद हम उसका वजन लेते थे। उसके चलते हमें पता चलता था कि बच्चों का वाटर लॉस कैसे होना, ताकि हम उस वाटर लॉस को बच्चे लोगों को न्यूट्रिशन के माध्यम से कैसे हम उसको हासिल करें, इसका प्लानिंग हम लोगों को करना था। उसके बाद हम 1-to-1 काउंसलिंग की एथलीट्स के लिए। तो हम लोगों को ये प्लानिंग हम लोगों का पहले ही था। तो जो पेंडेमिक पीरियड हुआ उसके चलते हम लोगों को बहुत मुश्किल नहीं हुआ बच्चे लोग, किस बच्चे को हम क्या न्यूट्रिशन देंगे। और आप लोग इस लाइन से सभी लोग हैं तो पता ही होगा कि एथलेट्स जो होता है, एथलेटिक डिसिप्लिन के लिए मोरलेस 2300 कैलोरी बच्चे लोगों को जरूरत होता है पर डे। और हॉकी गर्ल्स है, गर्ल्स के लिए 2100 कैलोरी की जरूरत होती है। कबड्डी जो है वो थोड़ा हायर रेंज में आ जाता है, 2800 किलो कैलोरी की पर डे जरूरत होती है। और रेसलिंग में वेट कैटेगरी के हिसाब से 3000 से लेके 3200 तक की रेंज में इनको डाइट की न्यूट्रिशन की जरूरत पड़ती है एज पर देयर रिक्वायरमेंट इन द बॉडी। तो ये रिकॉर्ड हम लोगों के पास था। उसके हिसाब से जब ये लोग सेडेंटरी सिचुएशन पर आ गए तो इनका किलो कैलोरी हम लोग 1800 से लेके 2000 तक का हम इन लोगों को बताए। हम ये इन लोगों को हम मोबाइल के थ्रू बताए, क्योंकि ये एक बहुत बड़ी क्रूशियल पॉइंट जंक्शन हो जाता है जब बच्चा हाई ट्रेनिंग से लेकर एकदम जब सेडेंटरी में आ जाता है, जब ये लोग घर चले जाते हैं। हर साल भी हम लोग इस बात को देखते थे, नजर करते थे। बच्चे लोग जब घर से वापस आते थे तो इनका वजन बढ़ जाता था। तो उस बात को हम इस बार टाइम टू टाइम मोबाइल के थ्रू, बाद में जूम के थ्रू हम बच्चे लोगों को बोलते रहे, क्योंकि पहले ज्यादा डिमांड था बॉडी का। उसके हिसाब से आप समझ सकते हैं कि 3000 किलो कैलोरी से अगर 2000 किलो कैलोरी पे हम आ जाते हैं तो बच्चों की जो मेंटल एडेप्टेशन का जो सिचुएशन होता है न्यूट्रिशन पॉइंट ऑफ व्यू से, और खाना खाना, अच्छा खाना खाना हर एक को पसंद होता है। और आप लोगों को जानकर ये भी अच्छा लगेगा कि साई ने शेफ भी एंगेज किए हुए हैं, असिस्टेंट शेफ भी एंगेज किए हुए हैं, और न्यूट्रिशनिस्ट के साथ वो लोग लगातार बैठते हैं और खाने का टेस्ट जो है उसको बदलाव लाते हैं। और 3 मील के साथ साथ जब गेम पे ये लोग जाते हैं उससे पहले भी एक मील देते हैं। उसके बाद वापस आके भी हम उन लोगों को थोड़ा सा स्नैक्स कुछ है वो भी हम, उसका भी हमारी प्लानिंग होती है सारा दिन भर में। तो ये एक बहुत बड़ा रेवोल्यूशन आया हुआ है। और एक रेनेसांसी मैं बोलूंगी, साई के जो मेन डिपार्टमेंट है, मिनिस्ट्री हम लोगों को बहुत मदद कर रहा है। पहले हम लोगों को समझाना पड़ता था कि स्पोर्ट्स वालों के लिए ये चीजें जरूरत है, तो समझाते समझाते बहुत टाइम लग जाता था। तो नाउ वी आर रेडी। हम लोग इसमें मैं एक बात और भी जोड़ना चाहूंगी, ये जो पीरियड है मार्च से लेकर अप्रैल तक की पीरियड, ये पीरियडाइजेशन खेल में हमारे साल जो पूरा 12 महीना होता है, 12 महीना को हम मेन 4 हिस्से में बांटते हैं। 4 हिस्से में बांटते हैं। उसमें पहला पीरियड होता है कंडीशनिंग पीरियड होता है, वो 4 वीक्स से 6 वीक्स तक का होता है। उसके बाद प्रिपरेटरी पीरियड होता है, वो भी 4 to 6 वीक्स का होता है, 2 महीना भी इसको तक चलता है। फिर प्री कंपटीशन पीरियड होता है, फिर कंपटीशन पीरियड होता है, फिर ट्रांजिशन पीरियड होता है। जो मार्च और अप्रैल का महीना, ये हर साल ही हमारे लिए एक ट्रांजिशन पीरियड होता है। तो इस बार क्या हुआ कि जब बच्चे चले गए, हमारे जो पीरियडाइजेशन है, पीरियडाइजेशन के साथ बहुत मिसमैच नहीं हुआ, तो हम लोगों को, बच्चे लोगों को डील करने में बहुत मुश्किल नहीं हुआ, क्योंकि इस टाइम वैसे ही बच्चे घर पे रहते थे। अप्रैल महीने तक का जो फर्स्ट मंथ का जो लॉकडाउन था, उस लॉकडाउन पे हम एग्जाम पे ही बच्चे को बिजी होते, हालांकि इस बार एग्जाम नहीं था, तो उन लोगों ने अपना जो डेली शेड्यूल घर पे होता था, ट्रेनिंग पे हम दिखा के कुछ नहीं बता पाते थे, पर हम शेड्यूल कोच जो है अपना डिसिप्लिन वाइज हर कोच हर ग्रुप में शेड्यूल बताते थे। उसके हिसाब से हम दो जो हमारी ग्रुप ऑफ एथलीट्स थे जो घर पे थे, उन लोगों को हमने एक जैसे उनका एक्टिविटी कम हो गया, दाल खिचड़ी खाने के लिए हम बहुत ज्यादा जोर दिए, और हमने चना जो है सफेद चना, उसको पीस के उसको साथ कुछ बटर मिला के उसको थोड़ा सा टेस्टी बनाने के लिए बोला गया है बच्चे लोगों को। पेरेंट्स के साथ भी हम लोगों ने इंटरेक्शन किया। राजमा, फिर जो हाई प्रोटीन पल्सेस जो होती है, उस पल्सेस के ऊपर हम ज्यादा जोर देने के लिए बोले, क्योंकि हर एक का इकोनॉमिक कंडीशन जो है वो हर एक का बराबर नहीं है, तो उसमें चलते जो अच्छा एफर्ट कर सकते हैं और जो कम एफर्ट कर सकते हैं, उनका एक बीच में एक मात्रा लेके हम इस हिसाब से हम बच्चे लोगों को गाइड किए। चना हर एक के घर में ही होता है, सफेद चना की अवेलेबिलिटी रहती है, काले चना की अवेलेबिलिटी रहती है, राजमा की अवेलेबिलिटी रहती है, तो दाल के ऊपर हम ये इन चीजों पे हम जोर दिए। और जो खिचड़ी बनती है, तो आप लोगों को पता है खिचड़ी में दाल और चावल टूट के एक कंप्लीट फूड बनती है, तो कंप्लीट फूड की तरफ हम बच्चे लोगों को ज्यादा ध्यान दिए, ताकि कम खर्चे में भी, और अवेलेबिलिटी भी कम था, लोगों का बाजार जाना भी मुश्किल था, मार्केट में भी कुछ अवेलेबल नहीं था, तो जो घर पे अवेलेबल था उसको हम प्रोवाइड करने के लिए बोले। और जो हमारे इधर जो बच्चे लोग बंद हो गए थे, उन लोगों के लिए जो भी हमारे पास स्टोर पे था, जैसे कि थोड़ा मूंगफली वगैरह हुआ हमारे पास स्टोर पे था, थोड़ा गच्चक मूंगफली का जो चिक्की होता है वो हमारे पास अवेलेबल था, थोड़ा सा मोनाको, थोड़ा सा आपका काजू, ये सब हमारे पास जो अवेलेबल था वो हम इन लोगों को प्रोवाइड किए। और दाल चावल, हम प्लेंटी ऑफ दाल हम उनको ड्रिंक करने के लिए एडवाइस किए। उसके साथ राइस का जैसा भी है, दाल रोटी भी है, उसके साथ थोड़ी दाल का वैरायटी चेंज करके दिए, ताकि उन लोगों का साइकोलॉजिकल स्ट्रेस ना हो। इसमें सभी लोग, हम लोग खिलाड़ी के साथ साथ हम सभी लोगों ने एक्सपीरियंस किया हुआ है। जब हम घर पे बंद हो रहे हैं, तो हमको एक मेंटल प्रेशर होता है कि हम घर पे बंद हो गए हैं और हम कुछ कर नहीं पाए। तो मैंने जब लॉकडाउन थोड़ा सा नॉर्मलाइज हुआ, जब सेकेंड फेज पे हम आ गए, मई महीने पे हम आ गए, तो उसके वक्त हम जूम मीटिंग का भी बंदोबस्त किया करके हम थोड़ा सा उन लोगों को बताए कि जैसे हम घर में बैठे हुए हैं, पहली बात है उसकी जो पॉजिटिव पॉइंट्स है, जैसे हम अपने पेरेंट्स के साथ बैठे हुए हैं, अपनी भाई बहनों के साथ बैठे हुए हैं, और जिंदगी दौर में हम इतना बिजी होते थे कि हम लोगों का जो घर वाले जो है उन लोगों की तरफ हमको ध्यान नहीं होता था। तो हमने बताया उन लोगों के साथ इंटरेक्शन ज्यादा करने के लिए, ताकि ये स्ट्रेस कम हो जाए। थोड़ा सा लूडो खेलने के लिए, थोड़ा छोटा मोटा वो आपका जिप पजल जो है वो पजल खेलने के लिए, कैरम खेलने के लिए हमने प्रोत्साहित किया, ताकि साइकोलॉजिकल स्ट्रेस एथलीट्स बच्चों पे ज्यादा हो जाता है जब वो बंद हो जाते हैं, क्योंकि उनकी बॉडी एक्टिविटी इतना ज्यादा होता है, उनको खुल के जीने का इतना आदत होता है, उसके बाद एकदम बंद हो जाना वो एक प्रॉब्लम है। तो उनको कई इंसिडेंसेस बताए। कभी बहुत जगह पर ऐसा हुआ, जब कोई ऐसा पेंडेमिक आता है तो बंदे को दस्त लगता है या कोई कुछ हो जाता है, बंदे तुरंत बहुत सिचुएशन खराब होता है। वो हमारा कोई सिचुएशन खराब नहीं है, हमको सिर्फ घर पे बैठना है, हमको इंजेक्शन भी नहीं लग रहा है, हमको कोई बांध के भी नहीं रखा है, हम घर पे ही, हमारी लिमिटेशन हो गया है खुल के जीने का, उसके हिसाब से हमें अदरवाइज बॉडी में कोई तकलीफ नहीं हो रहा है, जो हम बहुत ज्यादा मेंटली इस बात को स्ट्रेस ले। तो ज्यादा तकलीफ वाला सिचुएशन मैंने उन लोगों को एक्सप्लेन किया, हम लोगों ने, हम कोच ने भी एक्सप्लेन किया, हमने भी एक्सप्लेन किया, न्यूट्रिशनिस्ट ने भी एक्सप्लेन किया, डॉक्टर ने भी उस बात को एक्सप्लेन किया। तो सब लोग ने अपने अपने स्पेयर से इन बातों को एक्सप्लेन किया, ताकि उन लोगों का जो मेंटल स्ट्रेस है एक जगह बैठने के लिए, है मेरी ट्रेनिंग नहीं हो रही है, वो सब हमने दूर कर दिया। और ऑल इंडिया लेवल पर हम लोगों का सुबह 7 बजे से ट्रेनिंग प्रोग्राम होता था, जो जूम पे होता था। वहाँ पे एक जगह पर बच्चे लोगों को डेमोन्स्ट्रेशन भी करते थे, उसमें कंडीशनिंग पीरियड का भी जो कंडीशनिंग होता है, कंडीशनिंग में बताया जाता था, और स्टेमिना इंक्रीज करने के लिए भी कैसे हर वक्त, जैसे हफ्ता आप लोगों को मालूम होगा कि जैसे 5 डिप्स लगाने का अगर एक्सरसाइज हमने पहला हफ्ता किसी को बताया, तो नेक्स्ट वीक हम उसी को ही 10 को करने के लिए बोला एज पर डे, क्योंकि हमें पता है वो बच्चे वो ले सकते हैं, लोड ले सकते हैं। उनका पहला रिकॉर्ड के मुताबिक हम उन लोगों को उस हिसाब से एडवाइस किया, ताकि वो जो इंक्रीजिंग जो लोड है वो एकदम आहिस्ता 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 करके, ताकि बोर्डम भी ना होए। एक्सरसाइज में भी हम वैरायटी लाए, अगर डिप्स भी दिया हुआ है, डिप्स में भी हम डिफरेंट काइंड्स ऑफ डिप्स दिया, मतलब कभी हाथ बेंड करके, कभी नी बेंड करके, कभी पूरा फुल बॉडी डिप्स दिया। थोड़ा चिन अप्स का भी कहीं कहीं अगर किसी ने बंदोबस्त कर पाया तो चिन अप्स का भी बंदोबस्त किया। फिर लोअर कैटेगरी में जो लोअर लेग है, लोअर लिम्स का एक्सरसाइजेस क्या है उसके हिसाब से हमने बताया। तो और जो हमारा इधर जो बच्चे थे, उन बच्चे लोगों के लिए इन हाउस वो लोग थोड़ा सा ग्राउंड पे जा पाते थे, मगर कोच नहीं था। तो हमारे इधर जो इन हाउस कोचेस थे, वो इन हाउस कोचेस उन लोगों को दूर खड़े होकर थोड़ा सा एक्सरसाइज का बता देते, तो उनकी मेंटल भी जो इन लोगों का तकलीफ था वो भी काफी हद तक कम हो गया था। तो आउटडोर एक्टिविटी भी आहिस्ता आहिस्ता हम लोगों ने शुरू कर दिया है। एटलीस्ट तो हमने बताया कि उस वक्त हमने बताया, न्यूट्रिशनिस्ट हमारा नम्रता गुलाटी हमारे पास है, नम्रता गुलाटी टाइम टू टाइम गाइड करती रही है कि इस वक्त कितना उन लोगों का जो एक्सरसाइज है उसमें कितना इनको कैलोरिक इंटेक होना चाहिए। जैसे हम 2000 से लेके अब 2500 तक कैलोरिक इंटेक बढ़ाने के लिए बोला गया है, उसके हिसाब से हमने थोड़ा सा फ्रूट ऐड करने के लिए बोला, थ्राइस अ वीक फ्रूट ऐड करने के लिए बोला। उस वक्त वेजिटेबल भी थोड़ा सा आ गया था, वो भी ऐड करने के लिए बोला। थोड़ा मिल्क भी जो एफर्ट कर पा रहे थे उनको भी बोला कि थोड़ा मिल्क वगैरह लेने के लिए। तो उस हिसाब से जो हमें फीडबैक मिलता था, पेरेंट्स भी जो बच्चा जो दिखता था पेरेंट्स लोगों को कि हमारे सेंट्रल की तरफ से एकदम हायर लेवल से लेके इवन मिनिस्टर लेवल से लेकर ये बच्चे लोगों के साथ जुड़ना चाह रहे हैं, तो पेरेंट्स भी जो बच्चे ट्रेनिंग करते हैं, जो खिलाड़ी बच्चे थे, उन लोगों की तरफ थोड़ा ज्यादा ध्यान देते थे और इन हाउस बहुत अच्छी तरह मैनेज करते थे, ताकि इस प्लेयर को थोड़ा सा वेजिटेबल अच्छा मिले, थोड़ा सा दूध अच्छा मिले और फ्रूट अच्छा मिले। तो मैं पेरेंट्स को उस वक्त ही अच्छी तरह थैंक्स देती थी कि अपने खिलाड़ी बच्चे लोगों के लिए वो लोग भी एक्स्ट्रा केयर कर रहे थे। और जो एकेडमिक हमारे पास एथलीट था, उसमें हम लोगों ने क्या किया कि ट्रेनिंग हम थोड़ा सा बढ़ा दिए। पहले हम एक भी नहीं दे पा रहे थे, दूध भी हम नहीं मंगा रहे थे, क्योंकि दूध की पैकेट को हमको स्टेरिलाइज करना था, उसको बाहर रखना था, उसको अंदर रखना था ताकि वो दूध फटे ना, ठीक ठाक रहे, तो हम दूध मंगवा नहीं रहे थे। पर जब दूध की अवेलेबिलिटी रखी, ये थोड़ा सा प्रॉब्लम सॉल्व हो गया। जो हम लोगों का सैनिटाइजेशन का जो साधन था वो सब हम अरेंज कर लिए थे। तब तक वो हम मिल्क को हम उसके हिसाब से प्रयत्न करके उसको रखते थे, उसको हम प्रोवाइड करते थे बच्चे लोगों को। अंडा भी हम देते थे, अंडे का भी फॉर्मेशन हम बदल के देते थे। कभी अंडा एकला बॉईल करके दे दिया, कभी ऑमलेट हम बना दिए, कभी सूजी के साथ एग को मिला दिया, उसका एक चिला टाइप हमने बना दिया। इस किस्म से हम कभी उसमें ऑनियन डाला, प्याज डाला, थोड़ा सा टेस्ट में फर्क लाने की कोशिश किया, ताकि उनका मेंटल स्ट्रेस, एक तो पेरेंट्स के बिना वो लोग रह रहे हैं, सारे बच्चे अपने घर पे अपने दोस्तों के साथ, भाई बहनों के साथ है, तो वो भी उनके मन में था। तो हमने एक फ्रूट हम कोशिश किया, एक फ्रूट डेली इन लोगों को प्रोवाइड करने के लिए। जो घर पे है उन लोगों के लिए 3 दिन में 1 दिन के हमने रिक्वेस्ट किया था, प्रिस्क्राइब किया था। पर अपने बच्चे जो इधर थे उन लोगों के लिए हम एक फ्रूट उन लोगों को देने के लिए कोशिश की। इसके चलते वो लोग बहुत अच्छी तरह इस बात को लिए। हम एक इंटरेस्टिंग मैटर हम इसमें इम्प्लीमेंट किए थे। जब हम थोड़ा से बाहर जा पाए तो थोड़ा सा, हालांकि न्यूट्रिशन से थोड़ा सा बाहर ही था, मगर थोड़ा सा चिप्स, थोड़ा सा चॉकलेट, थोड़ा सा कुकीज, डिफरेंट काइंड्स ऑफ जो रेगुलर कुकी लोग खाते हैं उसके नहीं, थोड़ा सा वैरायटी हम दिए, ताकि बच्चे के मुंह पे हम थोड़ा सा मुस्कुराहट दे। जब हम पैकेट हैंड ओवर कर रहे थे तो देखा उनकी शक्ल पे मुस्कुराहट था, वो हम लोगों को बहुत आनंद दिया। हमको भी लगा हम एक नया चीज कर रहे हैं। और एक काम हम किए थे, बच्चे लोगों को थोड़ा सा किचन में आने का एक्सेस हम दे दिए थे। हम बताए थे उनको, अगर दूध से कुछ बनता है तो आप हमारे जो स्टाफ है मेस का, जो इन हाउस है, उन लोगों से उसको थोड़ा सा कुछ बनाने के लिए। तो उन लोगों ने, बच्चे जो थे, किसी को थोड़ा सा मिठाई बनाना आता था, राजस्थान की थे, तो उन्होंने थोड़ा उसमें से एक बर्फी बनाया, किसी दिन थोड़ा सा चावल डाल के खीर बनाया। तो उनकी जो इन्वॉल्वमेंट रही है इसमें उनके मन में आनंद भी आया है, जो स्ट्रेस था वो भी उनको चला गया, थोड़ा सा दाल मूट वगैरह भी खाने को मिल गया, उसी को थोड़ा सा और भेल टाइप बनाने के लिए बोल दिया, दे देमसेल्फ मेड इट एंड दे इवन, वो लोग खुद बना के हम लोगों को भी थोड़ा सा प्रोवाइड किए। ऑफिस तो चलता था तो वो भी आए ऑफिस में हम लोगों को ये तो प्रोवाइड किए। तो ये वातावरण में हमारी बहुत हल्कापन आया, बच्चे लोग बहुत एंजॉय करते थे, हम लोग भी एंजॉय करने लगे थे। और जब ये शेड्यूल बना रहे थे कोचेस के साथ, तो हम उसके चलते हमारा जो हफ्ते का प्रोग्राम, हफ्ते का भी एक प्रोग्राम होता है, उसमें एंड्योरेंस वर्कआउट होता है, स्पीड वर्कआउट होता है, फ्लेक्सिबिलिटी वर्कआउट होता है, स्ट्रेंथ वर्कआउट होता है। जिस दिन हम एंड्योरेंस का कोच बताते थे कि हमको सोमवार को एंड्योरेंस का वर्कआउट है, उस दिन हम बच्चे लोगों को पहले गाइड कर देते थे कि कार्बोहाइड्रेट इंटेक ज्यादा करने के लिए ये नॉलेज हम उन लोगों को प्रोवाइड करते थे, जैसे बनाना ज्यादा लेने का है, डेट्स ज्यादा लेने का है, राइस थोड़ा सा ज्यादा खाना है, पोटैटो ज्यादा खाना है, और ड्यूरिंग ट्रेनिंग इलेक्ट्रॉल पाउडर जो है, इलेक्ट्रॉल वाटर जो है वो लेने के लिए, वो ताकि एंड्योरेंस की वर्कआउट जो है उसके साथ उनकी एडजस्टमेंट हो जाए। और जिस दिन नेक्स्ट डे हम स्पीड वर्क के लिए भी, यूजुअली मंगलवार को स्पीड वर्क होता था, तो हम न्यूट्रिशनिस्ट ने प्रेस्क्राइब किया था कि पहला दिन रात को रेड मीट प्रोवाइड करने के लिए। तो जिनके लिए संभव हुआ उन्होंने रेड मीट प्रोवाइड किया, जिनके लिए संभव नहीं हुआ उन्होंने प्रोवाइड नहीं किया। मगर नेक्स्ट डे ड्यूरिंग ट्रेनिंग उसका आयरन जो इनटेक है उसको बढ़ाते, जैसे डेट्स हो गया, मनोका हो गया, ये सब हम उन लोगों को बोला लेने के लिए। और इन हाउस भी जो हमारा इधर इस सेंटर में जो बच्चे हैं उन लोगों को भी हम उस हिसाब से खाने का जो रकम है उसको हम उसमें भी बदलाव लाए। और जब फ्लेक्सिबिलिटी का वर्कआउट जब हम दिए तो हम उनको, बच्चे लोगों को बोले विटामिन सी ज्यादा खाने के लिए, गुआवा, आंवला, थोड़ा सा घी, ये सब इंटेक ज्यादा खाने के लिए, सो दैट the body can cope up with the workouts for flexibility. And then comes strength workouts. Strength workout के टाइम पर हम लोग पहले उन लोगों को बताते हैं, पहले भी बताते हैं ड्यूरिंग दिस पेंडेमिक ऑल्सो, जब वो लोग घर पे रह रहे हैं तो पहले ही हम उनको थोड़ा सा वैरायटी ट्रेनिंग से पहले बताते थे। स्ट्रेंथ ट्रेनिंग करना है तो चना, किसी दिन अंकुरित चना दे दिया, किसी दिन अंकुरित साबुत मूंग जो है उसको दे देते थे, उसको थोड़ा सा चाट बनाने के लिए, बना के खाने के लिए बोलते थे, और उसमें भी बदलाव लाने के लिए बोलते थे। देन आफ्टर ट्रेनिंग उसकी रिकवरी के लिए जो स्मॉल स्ट्रम प्रोटीन ब्लैक चना प्रोवाइड करते थे, मूंग प्रोवाइड करते थे, और उसमें साथ में फिर हम जो एग जो है, एग ट्रेनिंग के बाद हम उसको एग देने के लिए बोले, प्लस दूध में हम कोकोआ डाल के दूध लेने के लिए बोले साथ, ताकि उनकी जो वेज एंड टीयर्स हुआ ड्यूरिंग ट्रेनिंग वो सब पूरा हो जाए स्ट्रेंथ ट्रेनिंग का। तो ये जो कॉम्बिनेशन था ट्रेनिंग का उसके साथ हमारा न्यूट्रिशन का, ये बहुत बढ़िया ट्रेनिंग का, जो पहले जब हम लोग न्यूट्रिशनिस्ट हमारे पास नहीं था तो हम ये चीज मेंटेन नहीं कर पाते थे क्योंकि हमारे खुद को जानकारी बहुत कम थी। तो अभी हम जो कर रहे हैं करेक्ट वे में बच्चे लोगों को ट्रेनिंग भी हम दे पा रहे हैं, और उस ट्रेनिंग के साथ बच्चे लोग पहले बहुत थक जाते थे, टायर्डनेस बच्चे लोग का बहुत ज्यादा होता था, उसके लिए हम रिकवरी मेथड भी है। मगर रिकवरी मेथड होने के बावजूद भी अगर शरीर के अंदर ही कमी होती है तो रिकवर होने में भी टाइम लगता है। तो ये हमारे लिए बहुत बड़ी फायदा रही है, हम बेनिफिटेड रहे न्यूट्रिशनल इनपुट्स जो हमको आया था उसको देने के लिए। हमारे को बहुत इस बात को हमें बहुत फायदा हुआ, हमारे बच्चों को, हमारे को खुद को भी नॉलेज हमको बहुत बढ़ा। उसके बाद हमारा अभी जो सिचुएशन आया नवंबर महीने में, हम हमारा सेंटर जो है उसको हम खोल दिए हैं। खोलने के बाद हम लोगों को जो बताया गया था बच्चे आने के बाद हमको क्या क्या प्रिकॉशन लेना पड़ेगा, हमारी गाइडेंस आई थी गवर्नमेंट की तरफ से, हमने वो गाइडेंस पूरा उसको फॉलो किया। उस गाइडेंस का फॉलो का ये था कि पहले बच्चे लोग जिस दिन आए, पहले बात है एक ही सिंगल डे में एक ग्रुप ऑफ चिल्ड्रन को हमको रखने के लिए बोला गया था। तो एक पर्टिकुलर डे पे बच्चे आए, हम पहले दिन 20 बच्चे का ज्वाइन कराने का बंदोबस्त किए थे, और हमारा जो छोटा छोटा कमरा है, एक कमरे में हम एक बच्चे को रखे ताकि किसी के साथ किसी का लिंक ना बने। और उसके बाद हम 3 मील्स प्रोवाइड करते थे बच्चे लोगों को, और जो प्रोवाइड करते थे मील वो लोग खुद पीपी किट पहनते थे, उसके बाद ग्लव्स पहनते थे। ये लो डस्टबिन रखा हुआ था, ये बच्चे लोग के हर कमरे में ये लो पैकेट्स जो है वो रखे गए थे। उसके बाद इन लोगों को 3 मील्स बॉक्स में पैकेट करके हर बच्चों का दरवाजा ओपन करते थे, बेल बजाते थे और उन लोगों को हम पैकेट प्रोवाइड कर देते थे। जो न्यूट्रिशनिस्ट ने प्रोवाइड करने के लिए बोला था वो हम दे देते थे। मिल्क के लिए बाहर हम बंदोबस्त रखे थे, हॉट मिल्क हम बच्चे लोगों को प्रोवाइड करते थे, फ्रूट प्रोवाइड करते थे, ब्रेकफास्ट जो देने का होता था देते थे। आफ्टरनून में हम लोग राइस, दाल, सब्जी और पनीर हो गया, थोड़ा सा चिक्की भी एक दे देते थे और फ्रूट एक दे देते थे, क्योंकि बाद में ये लोग खाना खाने की तुरंत बाद नेक्स्ट डिनर से पहले चिक्की और फ्रूट जो है वो बाद में ले सके, उसके हिसाब से इंस्ट्रक्शन देते थे। मगर जब उनको प्रोवाइड करते थे तो हम एक ही साथ प्रोवाइड करते, ऐसा ही हम डिनर का बंदोबस्त किए। उसके बाद फिर से जब ये खत्म हो गया 6वां दिन पे हमने आरटीपीसीआर टेस्ट करवाया। उसके बाद तकरीबन सारे ही हमारे पास नेगेटिव थे, एक ही बच्चा पॉजिटिव था, उसके लिए अलग प्रिकॉशन जो लेना था वो हमने लिया। नेक्स्ट हमने इन लोगों का जब 14 दिन जब खत्म हो गया तो हम लोग दोबारा इन लोगों का प्लान किया है कि डॉक्टर से इन लोगों का टेस्ट करवाना। टेस्ट करने के बाद फिर हमने उनका ब्लड टेस्ट किया और हमको एक चीज का हमें बहुत फर्क लगा। जो ब्लड टेस्ट हम पहले किए थे जाने से पहले, उसके बाद अभी का ब्लड टेस्ट में जो न्यूट्रिशनल इनपुट्स हम दिए थे वो लिए थे क्या, उसको प्रूफ हो गया था कि जो डेफिशिएंसी बच्चे लोगों को पहले था उस डेफिशिएंसी में काफी सुधार था। तो ये हम लोगों को है कि जो इंस्ट्रक्शन दिए गए थे वो पेरेंट्स ने भी फॉलो किए, बच्चे लोगों ने फॉलो किया और हमारी एफर्ट जो है वो सक्सेसफुल रही है। ये हमारे लिए बहुत बड़ी बात है। और वाटर लॉस मेजरमेंट जैसे हम करते थे हम किए थे, मगर ये देखा गया है इसके चलते विटामिन डी की कमी ज्यादातर बच्चों में पाई गई, क्योंकि सभी लोग बाहर नहीं थे तो उसके चलते विटामिन डी की बहुत ज्यादा कमी थी। उसको भी अभी हम लोग किसी को इंजेक्शन दे रहे, किसी को सप्लीमेंट्स दे रहे, देके ये जो कमी है इस कमी को हम पूरा कर पाए उसकी हम प्रयत्न में लगे हुए हैं। और बच्चे लोग जो है वो ट्रेनिंग पे वापस चले गए हैं और हमने इसमें ग्रीन जोन बनाया। ग्रीन जोन में कोच भी रह रहे हैं, कोच भी बाहर नहीं जा रहे, कोच भी वही फॉलो कर रहे हैं जो बच्चे फॉलो कर रहे हैं। तो कोच को भी हम न्यूट्रिशनल डाइट दे रहे हैं साई की तरफ से, ताकि कोच में भी जो इन हाउस रह रहे हैं उन लोगों को मेंटल प्रेशर ना रहे कि उनको खुद का खाना क्या अरेंजमेंट करेंगे क्या नहीं करेंगे, बच्चे के साथ अच्छा तालमेल रहे और नजदीक जाके उन लोगों के साथ ट्रेनिंग कर पाए। इसलिए ग्रीन जोन पे उन लोगों को रखा। फिजियोथेरापिस्ट, न्यूट्रिशनिस्ट इसके हिसाब से उन लोगों के साथ बायो बबल एक हमारे एरिया है उस एरिया में रख रहे हैं। ये प्रिकॉशंस जो हमको लेने का है पेंडेमिक के टाइम में जो बताया गया था हम उसको ले रहे हैं। और न्यूट्रिशनल इनपुट जो दिए गए थे उसमें पिछले साल के बच्चे लोगों में जो हालात होता था उससे इस बार के हालात पे बहुत सुधार है। और ट्रेनिंग सेशन पे भी अभी हम लोग तकरीबन प्री कंपटीशन पीरियड सेशन पे हम पहुंच गए हैं। तो उस पहुंचते उस मैचिंग के साथ जो बच्चे लोग घर पे थे उसके बावजूद भी अभी हमको कंडीशनिंग पीरियड में वापस नहीं जाना पड़ा। हम प्री कंपटीशन पीरियड में जो ट्रेनिंग दे रहे वो दे पा रहे ओनली बिकॉज ऑफ न्यूट्रिशनल इनपुट्स एंड रेगुलर कनेक्शन विद द चिल्ड्रन रिगार्डिंग ट्रेनिंग। मुझे लगता है हमारा तरफ से जो हमने किया है इंटरेस्टिंग वे में हम इस बात को मैनेज किए हैं। बच्चे लोगों को थोड़ा सा हम खाना कैसे घर पे भी बनाएंगे वो भी बताते थे, थोड़ा सा स्पोर्ट्स का भी ड्राइंग के लिए भी बताते थे, कुछ खाने का भी ड्राइंग करने के लिए भी कभी बताते थे। तो इस हिसाब से थोड़ा सा सिचुएशन को हम लाइट करने की कोशिश करते थे। दे वर एंजॉयिंग अदरवाइज। और न्यूट्रिशन आपको पहले हमने बताया कि मैनेजमेंट एथलेट्स का 2300 कैलोरी का जरूरत होता है। हॉकी गर्ल्स है हमारे पास, उसी लिए 2100 कैलोरी का जरूरत होता है। कबड्डी का 2800 एंड रेसलिंग का 3000 से 3200। और इसमें 4 डिसिप्लिन आप लोग आप देख रहे हैं, उसके हिसाब से मेस में से हम इन बातों को डेली जो प्रोग्राम है उसमें बहुत बदलाव है। वेराइटीज ऑफ फूड हम प्रोवाइड करते हैं, डिफरेंट कॉन्टिनेंटल फूड भी प्रोवाइड करते हैं। आप लोगों को मालूम है कि बच्चे लोग खिलाड़ी बच्चे बहुत जगह पर जाते हैं, हर जगह पे अलग अलग सिचुएशन होता है। सिचुएशन होने के कारण उन लोगों को मेंटल स्ट्रेस होता है अगर खाना नहीं मिलता है, तो उसका भी हम वैरायटी डालते हैं। ये हमने एक मेन्यू का हमने जो सजेस्ट किया था ड्यूरिंग क्वारंटाइन वो भी आप देख सकते हैं। डेज के हिसाब से वैरायटीज भी आप देख रहे हैं। 3 मेन मील के बिटवीन भी हम लोगों ने छोटा छोटा पोर्शन पर इन लोगों को देते रहे ताकि इन लोगों का शरीर में जो जरूरत है वो जरूरत पूरा हो। ये वीकली मेनू थ्रू इट। उसके बाद आप लोगों को बताया कि विटामिन डी का डेफिशिएंसी थोड़ा पाया गया है। डॉक्टर हमारे पास है, डॉक्टर के मुताबिक हम उसके सप्लीमेंट्स भी दे रहे, आयरन सप्लीमेंट्स भी दे रहे, और जिसको इंजेक्शन की जरूरत पड़ी है हम वो इंजेक्शन करेंगे। थैंक यू।
Thank you so much, ma'am. Thank you so much for giving such an insightful knowledge. During this pandemic, the way the SI has managed, you have transformed the challenges into opportunities.
Yes.
You have taken that
Yes.
challenges into opportunities.
Yes.
Your entire slides is so simple, so lucid, and it's a takeover message to all of. And it was a challenging moment for SAI's part to take this physical, who are actively involved in all those sports, and suddenly they have transformed into a sedentary lifestyle, and to manage their nutritional status along with that cognitive status was a challenging task, and you people have done a wonderful job. You have not only done from your way out, you have also equally let your participate in the kitchen to give their nutritional input, and equally the entire team has done a wonderful job. It was such an informative session for all of us. We have really had gathered lots of knowledge how to manage all this sports personnel nutritionally, not only nutritionally, also the psychological aspect where the stress level was in fact too high, and you have taken it that challenges as opportunities. Thank you so much, ma'am, taking
But,
your valuable time and coming over here.
Madam, I would like to thank you people, because you have given us whatever we did it in house. But you gave us a big platform that we got the opportunity to discuss and share our views, rather what we have implemented, and we have given that opportunity. For that we extend our heartfelt
And especially to the students forum, ma'am, who are into the sports background, and they require your knowledge to be important so that they know what is happening from the Sports Authority of India. Thank you so much, ma'am. Thank you so much.
Thank you very much.
Thank you, Namrata, ma'am. You are also been a technical support for madam. I have seen
Yes, very much.
and also done our internship with this. Thank you, madam. Now, any more questions to anybody from anyone's side? I think the talk was so simple and it was so interesting, and people have gathered so much of information. Today we have taken the information, and before we have any queries, you have given us the information about how to tackle the challenges of this sports personnel, a challenging situation to handle, and people have done it very sweetly over there. Ma'am, one question is there from one. What kind of attention and training was provided to children who are tested COVID positive, especially for the sports person? This is one question from people.
COVID positive, when they were in house, no information was received that such a child is positive. We have not received any information, so we do not know. So we do not have anything who were positive. The children who went home, and then children who were here, those children were not tested positive. We conducted RT-PCR test when the children, those who were staying here, who conducted their test, so they were not positive, so they were negative. So we were not having much challenges for the positive children. And in-house, we are not having any information that anybody was positive.
Okay.
So we are not here, but after joining, asymptomatic positive, one child became asymptomatic positive. For that, we kept that child in a separate room. We already kept every child in a separate room. So that child was kept in a separate room, and then after 6 days, then again 14 days where he was kept into quarantine. Like previously, other children were kept like day 1 up to day 14. So they were kept quarantined. But the child after 6th day who was tested positive, he was quarantined for another 14 days. After that 14 days, we conducted again the test. Then when he found negative, then we have allowed him to join us, and during that period, nutrition inputs were given, whatever was given to others. But vitamin C was given as per prescription of the doctor. Then what vitamin D was given, but these tablets were given, medicines were given as per the prescription of the doctor for the positive child. Then after 14 days, he was negative, and now he is
Back to normal.
to normal.
Okay, ma'am. There is one more question for you.
Yes.
Ma'am, what indoor exercise recommendations were given when there was a complete lockdown to this sports player person?
उसमें that for that we dips was prescribed for arm strength. Then squat was prescribed for leg strength. Then abdominal strength. Sit-ups were prescribed for abdominal strength, and some back exercise, some yoga exercise also were prescribed for maintaining the back muscles, the Dhanurasana and other Bhujangasana, Talavasana, likewise, so that the back muscles are strengthened. This kind of exercise were given. Spot running were given, and we encourage the parents even to take a belt around the child and to hold it, and the child was asked to run fast to give the speed training. When we ask them for doing speed training, so this way we ask them to do. So and we for endurance, the same exercise we ask them to continue for a longer period of time. Flexibility, like split, that can be done in house. Bridge can be done in a very small area. So for doing this flexibility exercise, there was not much problem. But for strength training, there was little bit problem. But when these push-ups, dips were enough for doing the strength training. So I think these were
These are the
not, I think
another question for you.
they were provided by coaches.
Okay.
And there were water bottles. So we asked the children to fill the water bottles. Then with the water bottles, they were asked to
That like carrying up and down with that. So muscle strain was given.
and then in the legs also keeping that bottle within the leg, then to raise the leg and bring it down.
Okay. Ma'am, another question for you. What foods are recommended to a sports person who have been in a lag phase, that is being in a long gap from the routine?
Who have been in
a long gap from the routine schedule of their physical activity or the sports, I think. What kind of diet is prescribed to regain the stamina and energy naturally? Means there is a lag phase for that sports person. Again, he is want to go back on the track. So what are the diet you people are recommending from the side?
Diet, I told that long phase there was gap, but we ensured that the children are not without training. So when they were in a small room also, they were encouraged to go through the training program. So they were not away. The long absence of training was not there, except within 1 month. 1 month also, we contacted the children through mobile and we gave the schedule. And the children, they have told that they have performed it. And now what the situation we are seeing, that actually they have performed it. So during that time, we prescribed them to have high protein diet, means dal, pulses. We asked them to take egg. We asked them to take milk. Also we provided. And
Ma'am, one last question for you. I know you are busy. Is it safe to use carotene as a sport supplement instead of dietary sources? Carotene as a sport
supplement. We are not talking about the supplement. Supplement means only vitamin D tablets. That is not supplement. Vitamin D tablets. We are not providing any supplement to the children. We are preferring the diet through nutrition that we are providing. This practice is not maintained in our Mumbai center, and during vitamins iron deficiency and for vitamin D deficiency only we are providing these supplements through tablets we are giving, and fruit also we are providing but now vitamin D will be there. They will be having because they will be practicing hockey players. For hockey players, there will be no problem because they will be practicing in the open air and under the sun, under the peak sun. So there will be no problem for hockey players. But since wrestling is an indoor game and kabaddi is also sometimes indoor and sometimes outside, kabaddi is also not big problem is there. But for wrestlers, there is a problem because it is became totally indoor. But through this way, we are trying to provide them the vitamin C, and we are asking the children to sit under the sun. That we have
Last one, ma'am, blood test is needed. Blood test needs to be done for all the athletes who have rejoined you post the lockdown period.
yes, we have done it
Yeah, the
because
RT-PCR we have done for
we
everybody.
had the provisions, and because without that we cannot give them the nutritional inputs that we cannot give them because something will be more which is not required, that is also not required. So likewise we have provided, and blood test was mandatory for them.
For everybody. Thank you so much, madam. It was really a very interesting session, as I can see over in the chat box over here. Thank you for your inputs, what you have given for the sports person, especially during this pandemics where the difficult situation were a bit difficult to handle. But the management you taught us today, how to manage it from the home front. Thank you so much. It was such an awareness message to all of us. Thank you so much, ma'am. Now over to the next speaker. Before that, I would like to hand it over to my colleague, Ms. Bhavisha Sancheti, who will be now taking over to the next session. So,
thank you so much, Rupali ma'am. I would like to take a moment and present my screen so that I can welcome the next speaker for the day. Is my slide visible?
yes. You put it, yeah, now it's visible. Yeah, continue.
Thank you so much. Gives me a great pleasure and honor to invite our next speaker for the day, Dr. Karen Susan Cherian. She is currently working as a scientist with a specialization in sports nutrition under the MYAS NIN department, which we all know is associated with ICMR. She is also a faculty member teaching the master's level student of sports nutrition from over the past 2 years. Her educational qualifications comprises her bachelor's and master's degree from the Food and Nutrition Department from Women's Christian College, Chennai. She is an accredited level 2 anthropometrist as recognized by the ISAK, which stands for the International Society for Advancement of Kinanthropometry. She was also awarded the JRF, by which she has also pursued her PhD. And the degree was also awarded to her by the Osmania University, Hyderabad in 2019. So one of her latest achievements. Her research area specially expertise would include energy expenditure, energy availability, and body composition. And she is very passionate to develop different sports research and educate young athletes, especially so that they can go ahead with their training in a very performed way. She's been invited as a resource person for various at many platforms, and also have reviewed and published research articles in various areas related to sports nutrition. She's also received her travel grant from the to showcase her research paper in the European Congress of Sports Science, and also at an international conference held in Brazil in 2016. It gives us great honor and pleasure to welcome you, Dr. Karen. I would like to hand over the session over to you so that we can hear your expertise and gain utmost knowledge from it. Ma'am would be presenting from the topic of recovery nutrition and athletic performance and evidence-based perspective. Over to you, Dr. Karen. Thank you so much.
Thanks for the warm introduction. I hope I'm audible, and I congratulate and appreciate Dr. BMN Home Science College for organizing this webinar, the principal, the vice principal, and also Dr. Rupali for constantly being in touch and making sure that this event took place. I also want to thank Dr. Sushmita for giving us a very nice in-depth understanding of the practical experiences they have gone through during the pandemic. And it is very nice, heartwarming to see the role or the primary role of nutritionists now than ever before. And it's also so encouraging for all the young nutritionists that I can see on the platform. And that we all have a role to play in building or in contributing in a very small way to build the athletic fraternity of our country. So mine would be a knowledge session where probably you could take some tips home and feel free to
Excuse
ask
me,
questions
Miss
because
Karen,
that's how.
before you start, due to the internet, I could from your end. If you can switch off your for a clear audio for all of us, there is an echoing coming from the back of your side. So we are not able to hear you clearly.
Okay, can you hear me now?
There's a sound is getting echoed.
Okay. Second, I'll try to. Is it still coming?
Yeah, now you
Is
continue.
it still?
Continue. It's okay. Yeah,
Has it reduced?
yes. I request others all to please mute your audio also so that we can get internet issues will be resolved.
Okay, so if there's anybody, if you don't, thank you for informing me this. If there is any issue, like please let me know. Is it fine now?
Yes, it is fine. You can start off now.
Okay, fine. I'll just share my screen. I hope my slides are visible.
Yes, put it on slideshow. Yeah, done.
Yeah, fine. Okay. So, yeah, as I was saying, my name is Dr. Karen. Thank you for introducing me so well. And today I would be giving you or trying to brief on recovery nutrition because that's something that's very, very important. And especially in this present context of training with a higher amount of infections around, how do we tackle it? So to give you an overview of what recovery means and also what are the nutrients probably to keep in mind when athletes come back to train after COVID-19. So the outline of my talk would be what are the physiological changes that happen during training which require recovery. So because it's all connected to nutrition at a very, so it would be understand for us as nutritionists and academicians, as I understand most of who you are involved in this field for some time. So it's always good to understand these changes. Second would be to understand the prevalence of infections among athletes and also the recovery from an open window of infections which generally happen after or post prolonged training. So this is something that is very specific. And also what is the current evidence on macronutrients and selecting immunomodulation and improving your recovery, right? I hope I'm audible. So moving on, recovery from physical training. That can happen because any physical training that you undergo, it can be 40 minutes, 30 minutes of running. It can be any type of training, is a stress to the body and it causes some amount of physiological stress, which in turn alter or alter some of the physiological pathways and processes which can also, it's good for you because it helps you adapt to that training given to you. But if it is too excess or if it is not super, if it does not being carried by recovery or if it is not followed up by recovery, what happens is then you might end up into some clinical condition, right? So being an athlete, they go through a lot of training. Sometimes some days are heavy training, some are light training days. But during heavy training or all-out training days, when there is a loading phase, there are tendencies that he or she will undergo a higher physiological stress compared to another day where there is a light training day. So first thing we have to remember is that each training day has to be looked at differently, and recovery for each training day will be different simultaneously. So the recovery, what does recovery mean? Okay, there are two types of recovery. One is acute. I hope all of you know all this. Like if I'm repeating, I'm extremely sorry. But for the continuation's sake, so there's an acute phase of recovery, that is the recovery between training sessions. So that's why generally if you do 4 or 5 repetitions, you get like a 30-second break. Okay, that is for you to immediately recover for the next session. And there is a chronic recovery that is between training sessions. So nutrition has a role in both acute and chronic recovery. And what by definition recovery means is the rate of return of physiological functions to that of rest. So how fast, rate is nothing but time. How fast can a person recover, or can all the functions or the physiological functions or changes that the training with that, how fast can that person return to rest? Okay, so that is the rate of return of physiological functions, and it is generally multifaceted. That means there are multiple ways of recovering from a state of physiological stress. Now, what do you need recovery from? Generally, you need recovery from fatigue. That is what most of the athletes would want recovery from. Now, what is fatigue? In simple terms, it is tiredness, cumbersome, you're feeling heavy, burnt. I mean, this is linked state, or in the perception of or mental state, like how you say your mental well-being, you're feeling something, right? So fatigue is also a feeling, but also more so it also is a performance outcome. That means if the athlete is not able to voluntarily contract himself at maximal force, then you call that person is under fatigue. So there are various ways in which fatigue is assessed continuously, and it needs to be monitored, because when you look at fatigue, there's a very high rate of in fatigue. Not all athletes would feel the same. Sometimes a heavy loading might not affect one athlete, but it can affect the other athlete. So every individual athlete is very important, and it is important to understand, even if one person is going through that state, how can we help him out? So something to keep in mind is that both recovery and fatigue is individually varied. That means recovery is the rate. That means there's a time involvement. For some training, it will take 2-3 days, right? Generally, they say for every training session, the recovery 94 hours to 96 hours between various individuals. For some people, it will be early, but for some people it might take around 96 hours. So this is something that we have to keep in mind, that recovery is not static. It is continuously changing based on the individual and based on the number of muscles involved in training. So if the muscles involved in a particular training is high, and that training is high intensity or heavy exertion or for a prolonged duration, then you as a nutritionist should also understand that there could be some strategies that we could use to help that person. Now, when I talked about fatigue, there are basically 2 types of fatigue that we should be aware of. One, peripheral fatigue, which is at the skeletal muscle level. So most of the activities, if you're doing a bicep curl, your biceps are basically, your muscle is contracting, and that is at that level, if there is any problem, that is called the skeletal muscle level. Now for the biceps to contract, your central nervous system needs to be activated. Okay, it gets a stimuli, like when you lift the weight, the nervous system already gets a stimuli that I need to contract now. It sends neurotransmitters like dopamine and other activity transmitters, which help you to perform the intensity with vigor, with more efficiency, right? So fatigue can happen at 2 levels. One is the peripheral fatigue, and the other is the central fatigue. If it happens at the muscle level, it's called the peripheral fatigue. If it happens at the central nervous system level, it's called the central fatigue. It is also called a psychobiological state. So this is also something important for us to understand. Psycho is psychology. That means it decreases the mental capabilities, or it affects the mental capabilities, especially the training motor skills. It basically affects the motor cortex. Okay, that is the region where you plan, you control all the voluntary activities that you have to do. Muscle contraction is a voluntary activity, and if it has to be triggered, the central nervous system needs to be active, especially the motor cortex region. So this Now, what happens if you have a peripheral fatigue? Then you get into a state called the delayed onset muscle soreness. Okay, this is most common. Like generally, an athlete can experience fatigue during training session. Rest, it comes back to normal. But if you're doing a very strenuous exercise, then the soreness lasts for a long time. Now, how do we understand that there is DOMS or delayed onset muscle soreness? One of the ways in which we understand is the muscle damage markers, which is creatine kinase and lactate dehydrogenase, because in high intensity exercise, these enzymes are utilized. Now, if it is present more in the blood, that means it's not getting utilized and there is something wrong with the muscle itself or the activity of the muscle. The second pathway is whenever there is a stress in the body, your pro-inflammatory hormones and cytokines are triggered naturally by the hypothalamic pituitary axis, HP axis, and that causes an increase in your C-reactive protein and interleukin-6. This is most often found to be higher among athletes in general worldwide, because when they go through a strenuous exercise, these are the two markers that have been generally studied, and when these become present, it then further triggers a reduction in your maximal force for muscle contraction. Following, it's called the peripheral fatigue. Not always will you have a central fatigue. It's not necessary that both happen together, or it can happen either or. But if you have peripheral and central fatigue, chances are that the person will take a longer time for recovery, right? There is a decreased motor cortex response, which is the frontal part of the brain, which controls all your voluntary movements. When that happens, how does it happen? It happens by a decrease in dopamine, and which is an active hormone which increases your activity, boosts your performance. It increases your serotonin, which is your hormone which lets you sleep or reduce the activity, right? So lets you rest. So because of this kind of a decrease, the athlete himself feels that he is not able to put more effort. And this will lead to a decrease in motivation or attention on the part of the athlete. And it can make him feel that he has to put an increased effort to do that activity. So this is the same case for all of us, even when we sit in class for long hours. Now, there was a longer lecture that happened previously, so there might be some distress among you. So this is a common situational phenomenon, but in case of training, this is the mechanism that follows for fatigue. Now, what I just told you about fatigue is the neuromuscular changes that happen with physical training. There are also other changes that happen, which is the cardiocirculatory changes. This is also important. Why? Because whenever there is a physical training, if we are not providing enough, recovery fluids, I was happy that there's continuous measurement of among athletes that was done, whereby you can really understand what is the individual loss of fluid and provide the rehydration, or start the rehydration protocol way before the training, so that he doesn't go into the state of dehydration. This is very, very important for recovery. And why is it important? Because it helps in maintaining your cardiocirculatory function. Now, how does that alter when you do physical training? There will definitely be some level of dehydration. Sometimes it can be as high as 4% of body mass being lost among athletes who train at a very high intensity. This is called an exercise-induced hypovolemia, which is nothing but a reduction in blood volume, okay, or the plasma volume, to be more precise, gets reduced. When plasma volume is reduced, it decreases stroke volume, and when stroke volume is decreased, naturally your heart rate will be increased to pump or to increase your cardiac output, so that blood flow is maintained through the working muscle. When that happens, what happens is you'll have to put in more effort to get oxygen, and your oxygen increases because your body is actually going like your heart rate is increasing, your physiology is going through some kind of a stress. When this happens, the next stage is that your repeat sprint action or ability is decreased, and when this happens, you will find it difficult to maintain your core temperature, because to maintain temperature is very, very important, and that's why we drink enough fluids and we make sure that our temperature is always maintained at a fixed rate, right? If it cause heat stress, if it is very high, it can cause heat stress. So in the recovery process, the fluid management is very, very important, and it is mainly to resolve this, or to make sure that the cardiocirculatory function is happening normally, which includes temperature regulation, which includes enough flow, supply of oxygen to the working muscle, enough flow of blood to the working muscle, and things like that. So this is how the mechanism really happens. Of course, all of us really know about the metabolic, which is very, very common. What the nutrients, okay, so there will be a decrease in phosphocreatine, but because phosphocreatine can easily be restored, and it just with few seconds of interval it can be replenished or restored. So after every set, when you give a 30-second break for any short intense activity, it gets restored. Glycogen stores, if there is a very exerted activity that the athlete is doing, an all-out performance, there are chances that for this entire to be restored in the body, it might take from 2 to 3 days. I mean, this is reported in the literature. And apart from this, there's also lactic acid that accumulates during or post a strenuous exercise. There is also oxidative stress. There is increased amount of H+ ions which are released into the blood, which increases the blood acidity. And also there is increase in blood ammonia. How is this an increase? When all these stores are used up, your body also breaks down that is deaminated. A lot of ammonia is produced by the skeletal muscle, which is released readily into the blood. And
Karen, sorry to interrupt you in between. If you can switch off your video for a clear audio, then it would be great, because in between your voice is breaking, so we are not able to hear you clearly.
okay, so sorry for that.
Yeah, you again represent the slide. Put your video off for a clear audio from your end. There is a poor internet I can make out from here. Fine, just reshare the slide again.
One second.
Yes, put it on slideshow.
Yeah. Were you able to hear now?
Yes, you are clear now.
Okay. So yeah, I think there is some network fluctuations here.
Yeah.
Okay. Yeah. So should I start from metabolic changes? Is that fine?
Yeah, start from.
Okay. So yeah, there are a lot of decrease in stores of phosphocreatine, glycogen, and there's an increase in lactic acid naturally when there is a lot of anaerobic exercise that is being carried out. In the process of aerobic oxidation, there is also a lot of pro-oxidants that are generated that can cause oxidation or oxidative stress in the body. So these are all changes that happen during any and every training. And these changes are very crucial for the athlete to train and adapt their body to the added demands. For example, why are you giving a physical training or stress? You want your body to change in some way for the better, or for a better function, or for a better parameter that will help in performance. So when you're undergoing these kind of changes, physiological changes within, by giving a training, it's also important for you to give or provide enough nutrition, so that you make sure to give enough nourishment for these activities to be enhanced. Or for example, if your glycogen stores are very low and you have trained, you're not doing a post recovery meal, and you're not following the guidelines required to make sure that you're eating enough carbohydrate, the next day when you train, it's going to add a stress to you. Instead of increasing your performance, it will naturally give you low energy and decrease your performance or the outcome which you want to target. Similarly, when you continuously, there is a strenuous exercise session that the athlete has undergone, it's very important for him to understand that appropriate fueling should be given. Otherwise, it will lead to something called oxidative stress, and that can cause in the long term damage. Also, blood acidity in terms of increased H plus ions after aerobic oxidation. There's a lot of H plus ions that can come into the blood, and this also takes time for you to void off and recover from this. There is also increase in blood ammonia, as I told you. When your energy sources are declining, even your adenosine monophosphate or adenosine adenine nucleotides are broken down within the skeletal muscle, and it's called deamination reaction, where a lot of blood ammonia is released, or ammonia into the blood is released from the skeletal muscle. Now, when this increase in ammonia happens in blood, that itself can have a deleterious effect in his performance. So for all these changes that happen in a normal regular physical training, it's generally maintained and controlled by the body itself. Okay, but if you're doing a heavy training, if you're doing a strenuous training, you should understand that there should be enough recovery protocol to back this kind of training for you to get an enhanced performance. Why am I saying this? Because it is a general process of training. Like if I'm undergoing some kind of a training, I understand that initially I will be able to say run 1 kilometer. Then there is something called overtraining or overloading that is generally done for any athlete, so that he attains his personal best and he keeps improving on himself. So when this overloading training happens, okay, it's called the loading phase. It is important that the athlete has enough recovery before he returns for the next day of loading. So what do I mean by recovery? Okay, it can be in terms of giving him some days, but it's not just days, it's also a lot of approaches that we need to take for recovery. That is, it can be nutritional, it can be non-nutritional. What are the non-nutritional approaches? It could be him having proper sleep, him using some kind of a technique. These days they use cold water immersions for quicker recovery, massages, some kind of a light intensity aerobic running, jogging. That is called active recovery, and passive recovery is just by taking rest. These are all non-nutritional strategies, but there are also a lot of nutritional strategies that we can use or guide the athletes with, so that they can recover. And if they recover, then they're going to have something called the functional overreaching. What is that? That is, functional means there is a parameter of performance of interest, for example, in an athlete. That means his function is that he has to have enough strength. Okay, he has to improve lifting weight from, now he is lifting say 50 kgs, he has to improve to 60. Okay, for that, a training overloading training is being provided. Then his main thing is, now he has to use the same muscles to lift. If he is able to lift that higher weight, that means that function which he had to do has been done. And it's called overreaching, because he can reach up to 50 easily. Overreaching is what above 50 can he reach? I mean, this is just an example for your understanding. So this kind of a functional overreaching is a constant aim of good training protocol, where they want to increase the performance, and every athlete goes through this kind of a phase. But during this phase, even if he does not sleep well, if he is not having a proper nutrition protocol, that can hinder this, and it can cause a negative impact of that training on his physiology, his physique, and his performance. Then it becomes something called the non-functional overreaching, which is a stagnation or decrease of performance, and it takes months for him to then, if it weeks or months for him to recover back to that previous state. And then also it's not being treated, long-term decrease in performance occurs, and there is an overtraining syndrome. So this is, some athletes definitely face this if they're going through a lot of stress factors in their life at that particular moment, and if they're not nourishing themselves well, if they're not having proper nutrition. So This is just a graph. The red line shows the overtraining or the danger, that is overreaching, and the blue line shows a proper training and recovery cycle. So when there is any kind of training, you understand there's red line and blue line. That means there is always overreaching is part of a proper training schedule, and it is generally done after every after every training. There is an acute fatigue, but at intensities, especially reaching from the preparation phase to the competition phase, there might be constant loading so that they can perform at the competition stage. So when that happens, there is a chance, so that is called the functional overreaching. If enough recovery or recovery nutrition is targeted during this phase, then you can see that the athlete will be able to get into the recovery zone and properly train and enhance his performance. But during this time, if proper recovery is not emphasized, then they go into a non-functional overreaching. And I know of coaches who give importance to this, because many coaches say that recovery is not proper, they know that, but as nutritionists probably we need to also give our nutritional strategies also, so that they will be able to recover and not enter into the state of non-functional overreaching and overtraining syndrome. So this is something that we all can keep in mind when next time when we interact with athletes. So what is this overtraining syndrome? It's a prolonged maladaptation. So always ask the athlete about his performance when he meets up with you, and how he's doing well or how he's feeling about his training, his performance, because psychology speaks a lot. If he is going to communicate what he feels perfectly, then you will also be able to provide or understand at what state he might be in. And overtraining is not just not only because of exercise, it is because of inadequate nutrition. It can be because of some illness he is undergoing or fighting. It can be because of psychosocial stressors, his relationship with the coach, his team, his family, his work, etc. Stressors are constant for athletes. They think of their career, they think of their life. So we take this quote for serious, that athletes, nothing should affect an athlete. That's something that we constantly we say that, but we should understand that and monitor continuously if for anything is affecting him. Then how can we tackle it? Because that can also have an influence, him not doing his performance or training well. It can give him a feeling of fatigue. So what are the symptoms of overtraining? It's prolonged fatigue. It can be hormonal disturbances or even psychological disturbances. He might be depressed, anxious, etc. Loss of motivation, loss of appetite, unexplained weight loss, and sleep disturbances. If these physical signs are observed among any of the athletes, it's important for us as support staff or people who want them to perform well, to trigger and target and give them the appropriate guidance needed at that point of time. This is one syndrome, and one of the clinical outcomes that can happen is the exercise-induced muscle damage, which basically is due to the fatigue, the peripheral and the central fatigue. The muscle damage markers, as you know, are high during this phase. There might be soreness, swelling. The pressure pain threshold is reduced. Okay, so when a force is exerted, the feeling of pain is very high. Okay, even with a minimal force, he feels that it's more painful. So that is increased. And temporary decrements in maximal force generating capacity. So that person is not able to lift weights or is not able to perform to the intensity he used to do before. So these are all signs for us to understand that he is not recovered properly. He is in a state where he needs some help in terms of an improved recovery strategies. Okay, of course, there are a lot of non-nutritional strategies that he can adopt, but getting the basics right is important. I mean, most of you would already know this, but it's important to reinforce that is the pre, during and post training requirements should be based on training and also should be individualized based on the athlete's requirement. Restoration of carbohydrates is important. High GI to moderate GI products are encouraged during the recovery phase, and always understand recovery starts before training, and to plan it is very important. Protein intake is important, especially the essential amino acids being incorporated immediately after training. Higher doses of greater than 40 grams are not useful. I mean, that's what we all know. Whole foods are encouraged, and restoration of fluid and electrolyte balance is encouraged. Antioxidant rich foods, fruits particularly, are encouraged. I'll come to that a little later. Also, everyday monitoring of hydration status, that is, of course, the daily loss of body weight, the color of urine, the thirst symptoms. This chart is very, very useful to daily, probe and ask and monitor if the athlete is consuming enough fluid as much as they're losing, and providing 150% of the fluid that was lost as body weight when you plan a rehydration protocol. Now, how does a diet of a strength training athlete vary from that of an endurance training? According to principles or according to literature that already exists, most of the strength training, a higher carbohydrate proportion and a higher protein intake is recommended. But of course, before that, it's important for all of us to estimate individualized energy requirements, which you can use by a factorial approach, because individual variations are very high when it comes to training, when it comes to providing diet. Okay, in a mess setting we can provide only fixed calories, but when you're looking at individual performance of an athlete, the variation, like we have in literature, it's also been reported around 1500 to 2000 calorie variation among similar athletes who participate in the same sport doing the same training, have a variation of 1000 to 1500 calories. So this is something that you as nutritionists should keep in mind, because it is not about giving a uniform plan. The energy might vary, and base your balanced diet, that is your carbohydrate, protein and fat proportions, on the energy that you estimated. And it should be in strength or high intensity training, a higher proportion of carbohydrate is preferred, while in an endurance training which lasts for more than 1 to 3 hours a day, in literature, okay, a higher proportion of fat has been found to be useful. Why higher? When I say it's not a keto diet or a high fat, low carbohydrate diet, is just an increase from 35 to 40% during the training phase. This has been reported by elite level rowers of their intake patterns for performance sake. So this is something that I've taken from the literature and also practiced it. It's useful. Pre-training, especially in the phase where they are training to that level of like 3 hours in a day if they're training. But the protocol for recovery, more or less, we follow what the guidelines, present guidelines exist for recovery. There is no difference. There are some reports which indicate that for strength training, even giving some percentage of protein before training is useful. So that has been studied a lot, especially resistance type of training, but there is no conclusive evidence on it. But we could still, based on the individual tolerance again, because some athletes tolerate or easily are able to digest this kind of, giving protein, but for some it might hinder their training itself. So based on individual tolerance and acceptance, the food choices and the recommendations need to vary. There is always, for any kind of training, the buffer is always 400 to 800 ml of fluid, but it's not always true. So it's important for you to measure or give consideration to the individual fluid losses. And 6 to 8% of carbohydrate solution is recommended, or 30 to 60 grams per hour of carbohydrate. Now, I'll also explain a study with this proportion as well in my future slides. So these are, this is some of the food choices you could have. Beetroot juice has been highlighted for its role in providing nitrates or nitric oxide, so to say, which gives or delivers oxygen readily to the working muscle without having to rely on the respiratory system. So the burden of respiring and getting oxygen into the skeletal muscle is reduced if beetroot juice is provided. And this kind of a juice would be useful for the endurance athlete, because there the aerobic oxidation level is more, and they rely more heavily on fat being the fuel compared to the strength or the strength training protocol. So otherwise, all of you almost know the requirements. I'm not, going back to it. Now, moving on, what happens when an athlete probably, is undergoing a prolonged strenuous training? What happens if he does not provide enough nutrition or enough recovery strategies? strategies. Most often we ignore the state of infections among athletes, which we think that is not, something that they'll just recover. That's what we think, but nutrition has a very important role there. So apart from injury, illness is the second most common reason requiring medical attention among athletes. The most prominent illness that is reported or prevalent is the upper respiratory tract infections, which is the common cold and influenza. The second is the gastrointestinal illness of infectious origin. Okay, this particularly happens when they are traveling and when they are eating out too often. It's called the traveler's diarrhea. 3 or more unformed stools occurring within a day, like vomiting, abdominal pain, nausea, fever is generally observed. Now, why does this happen? Most often it's due to food or water contaminated by E. coli, or in 10% of the cases, it could be a viral infection. Particularly, we are living in a zone where we are also added to this having a problem of COVID. And that would also mean that we should take extra precaution for preventing illness among athletes. So recovery nutrition, although it mainly targets on the macronutrients, protein, and also because delayed onset muscle fatigue will be reduced, but even antioxidants are very, very important for these oxidative stress to be reduced and also for the recovery to be fully exercised. And that's the reason that we need to understand what type of infections are common among athletes. So avoiding high-risk foods, and I think as nutritionists we should communicate this, because at most levels I have seen when you give athletes the buying power, they always choose a fast food or junk food, and they do not personally prefer to eat something healthy, or they don't get enough places to resort to such a healthy diet. So therefore, as nutritionists, it's important for us to encourage them to eat fresh fruits or vegetables. If they eat undercooked fruits or peeled and kept outside fruits without cleaning, foods from street vendors are very, very common among some of the athletes, and this was one of the common causes for a traveler's diarrhea to happen. So whatever training they did for performance goes into vain when they have some kind of an infection, which will cause a lot of time loss for them, and also in the long run might affect their performance at some stage. There is another GI disorder of infectious origin, which is runner's diarrhea. This is an exercise-induced diarrhea without pain, but sometimes it is associated with blood and feces. It's again multifactorial, so there is it could be, till now we don't know why this happens, but in some athletes this is found. Due to running vibrations, he can have diarrhea. Due to heat stress, it could be nutritional, like he's eating too much high fiber before training, or in his diet, in a daily diet, so high fiber might not be advantageous. Blood flow changes, like when he's running, due to peripheral logging of blood. When you run a lot, the peripheral blood clogging might happen in some cases for the athlete, and this could also cause some athletes to develop diarrhea. 70% of the illness cause time loss and 30% cause performance loss. So this is something that we need to be aware of, because time loss is equivalent to them losing their performance also in certain instances. Sometimes the time is very, very important. If they were training at a peak season, I remember I had one athlete like that. When we were giving him diet plan and making sure that she's following all the routine, she had a competition ahead, and just before the competition she eats something that was from outside, and then she falls sick. All her routine has gone down. Now she has to start from the scratch. Her stamina has gone down. So this is something that affects athletes, and as nutritionists we need to be aware of this and constantly educate them for not going into this kind of a state. And these are just basic food choices that they could alter, or basic hygiene tips that need to be taken care, or that need to be followed to avoid such a situation. So what are the risk factors for illness? As I already explained, training is one of the major risk factors, especially not all types of training, but strenuous exercise or prolonged exercise. Endurance athletes are tenfold more likely than power athletes to have illness, okay, especially the upper respiratory tract illness. So keeping in mind these kind of athletes needs to be nourished differently from the other type of athletes because they are a high risk group. Overreaching or overloading training, okay, so very intense training in an attempt to increase your functional performance, but might backfire at you if there is no proper recovery strategies in place. So the coach with a good intention might load the athlete, but if he's not following the recovery strategies or if he's not giving enough time for recovery, then he or she might be at a risk for not only injury but also it's called it is an open window for infection. So here it is, it's an open window. So the after these kind of training, the 3 to 72 hours post training is considered as an open window for any form of infection to readily come to the athlete. So when they are returning to training or returning to play, this could be some tips that could be provided to them, so that there could be some tips which I would be sharing in the future slides. So 3 to 72 hours is key, and that is also known as a state of immunodepression, that is exercise induced immunodepression. That means all your cortisol, all the stress hormones are increased, and your natural immune reaction or immune fighting ability is depressed. So what happens? Your natural, your natural reaction to fight infections have been, your innate immunity is suppressed. So when that happens, you're more susceptible to infection during this window. Okay. Other risk factors for illness is frequent long haul flights across various time zones for competitions, winter season, lack of sleep. If they're having less than 8 hours of sleep, that itself is a risk factor for him to be readily affect or cause getting upper respiratory tract infections. Low diet energy intake is also another factor. So when you look at immunity, like how does your body build immunity? There are two ways in which your body's defense mechanism is activated. One is the resistance. That means it objects or it does not allow for that is called fighting. Okay, that is why that is where antioxidants play a role, very important role. That is when free radicals are formed, it readily goes and attacks and tries to submissive, like not allow it to proliferate further. So resistance is your immune machinery being very active and trying to project its strength. Okay, your natural killer cells, your lymphocytes, your cytokines, your interleukins, immunoglobulins, all these are released at a greater level to fight the infection. The second is tolerance. So how best can you tolerate those kind of infections is something that that's the ability to endure the microbes and dampen the defense activity. So if a body has a very strong immune response, it will cause excessive tissue damage, and if the immune response is weak, it will damage the pathogen. Okay, so one thing you should understand is, even for the immune function to take place, or if you have to kill, for example, virus is entering my system or my lungs, what first happens? It tries to attach itself to one of the receptors in our cell, so that our body does not think that it's a foreign body. It knows that it's a foreign body. Once it attaches, our body will be able to recognize that, okay, this is a foreign body, I need to attack it. Now, how do your body attack it? It generates free radicals so that it can go and fight against that bacteria and try to kill it. So free radicals are generated as a protective ways to kill the microbe. Now the excess free radicals that are generated need to be quenched by the antioxidants. So free radicals play an important role in host defense against infection, but its increase in the body causes tissue damage also. Okay, so these are two sides of free radicals. We know that it is damaging, but it's also produced on a day-to-day basis, particularly when an athlete has done a strenuous exercise, and after that more stress is prevalent among them, and that's the reason that we need to provide enough nourishment at that level, which will build the resistance as well as the tolerance. Okay, so what happens if at this there is inadequate nutrients? When I say inadequate nutrition, it is excess in specific nutrients. For example, we are providing a lot of carbohydrate, but protein is not there. Deficiencies, any kind of deficiencies, negative energy balance, dehydration, use of high dose of supplements can also counteract to what you want to benefit. For example, if you use a lot of antioxidants, it will act as pro-oxidants and also cause, oxidative stress in your body, right? So using high dose of supplements are also considered as inadequate nutrition because it is not in adequate quantities. So when I say adequate nutrition, it's not excess, not less. What it does is, if the duration of that inadequacy is higher, then that causes an excess of, immune response. If the duration is higher, the immune response also will be higher. Severity of nutrient deficiency also matters. If any of these is more severe, then it can have a direct negative effect on the immune function. So a nutrient deficiency itself can have an effect on your immune function. It causes how? It causes a lesser availability of nutrients to your immune cell, and that's how immune cells are also made up of proteins, carbohydrates, okay, it's glycoprotein, some of them. So, and it also has to require energy for its activity. So if we're not providing enough nutrition, there is a direct negative effect on the immune function itself, and indirect negative effect on the immune function is by increasing all the pro-inflammatory hormones, cytokines, increase in glucagon and decrease in insulin, by which you will not be able to easily utilize carbohydrate in the body, right? This in turn will cause a reduction in the immune function. That means there will be a reduction in all the actions that your body, especially antibody production, phagocyte function. This is called an immune depressed or immune suppression state. Basically, depression is what is a better word. And at this state, if the athlete is training also at a very high intensity, there may be a higher risk for the upper respiratory tract infection. So these are things that we need to understand. Now, some of the nutrition to target this immune response. Resistance is often given by vitamin C and vitamin E nutrients, and tolerance is given by probiotics, beta-glucan, and vitamin D. So these two nutrients, all of this needs to be consumed together to get the maximum benefit. Now, it's not just, some micronutrients, but also the macronutrients are very, very important. I'll come to that. So as a question, let's ask ourselves, is there a link between energy being deficient and immunity? Okay, we saw that a negative energy balance has an influence on immune function, but there is some evidence that when a person is energy deficient, particularly among female athletes, it is more prone. It causes an increase in the infection rates. Okay, this has been reported. And what is a paradox is that most of you might be aware of anorexia nervosa, which is an eating disorder. It was associated with lower infection compared to starvation or protein energy malnutrition. So anorexia nervosa is also a condition where the athlete is in negative energy balance or in energy deficiency. However, during this period, the infection rates were lower compared to starvation or PEM. Why this could be is because protein was deficient in starvation and PEM, while in anorexia nervosa, the energy itself was deficient and not necessarily the protein intake. So what is suggested or recommended is short or long-term, mild to moderate energy deficits can be tolerated by the body, and it's not reported to lower immunity or increase infections. Further, it showed a reduction in the pro-inflammatory cytokines as well. So energy deficits might not be the cause, but energy deficits following which there is a protein or decrease in protein intake might affect immunity and infection. So even when athletes are going, because during the competition phase, when the training load will be higher, or just before the competition phase, when the training load will be higher, especially for athletes in weight sensitive sports or weight dependent sports, they also, try to manage their weight also during that time. So there are times when they have to go into the energy deficit state. As nutritionists, it would be important for us to make sure that they need the protein, not just to maintain their training, but also to keep them off from infections. Okay. Second is carbohydrate. Here the timing is very, very important. I'll just give you an example. So during training fueling, if you provide 30 to 60 gram per hour of carbohydrate in a 6% solution with electrolytes, what happens? Or what happens in training? There is a reduction in blood glucose during intense training. And if you're drinking only plain water, what will really happen? It will trigger the HPA, that is hypothalamic pituitary adrenal axis, will be activated. What it would do is it will increase your ACTH, adrenocorticotropin hormone, and that in turn will release cortisol into the blood, and it also increases your plasma epinephrine and growth hormones. So when this pro-inflammatory hormones or machinery is increased, actually cortisol is an indirect marker of your immune function or immune depression. Okay, so if there is an immune depression or cortisol is high, means there's stress, there is some kind of a that's some kind of an indirect marker. So if you're drinking only plain water and there is a reduction in blood glucose, this axis is activated. Okay, so there was a study done by Lancaster et al, and what they found is, so they gave a group of players 30 to 60 grams of carbohydrate per hour. The volume of drinks they consumed was 500 ml immediately pre-exercise and 200 ml every 20 minutes during the exercise. This is how the fluid protocol they monitored. They did a cycling at 60% VO2 max. So understand that there was a constant increase in the cortisol levels. They tested the plasma cortisol levels. However, in the group where there was a 6.4% carbohydrate solution being provided, there was a consistent decrease in the cortisol levels. It was never as high as the placebo or the group where they consumed 2% of the carbohydrate. So this is something that we can reflect on. That means if it's not only that the carbohydrate solution is useful for the glycogen repletion, but it's also going to help the athlete to reduce the immune stress or load on their body. Okay, some questions that rise when I talk about this is, but cortisol is useful, it is needed because especially in endurance training, some amount of stress hormones are needed, some amount of oxidative stress is needed because it causes training adaptation. That is, it leads the athlete, for example, stress, these pro-inflammatory cytokines, what it does is, it is known to activate pathways that will help in adaptation in terms of muscle building, in terms of increasing aerobic capacity. So there are direct signaling pathways that are activated just because of oxidative stress. But there is a difference between an oxidative stress being there and an excess stress being there. So there is a difference between that, and it's important for nutritionists to recommend antioxidants in line with the RDA, the present RDA that is available according to the ICMR, which is released in 2020, because that is what is recommended internationally as specific guidelines need to be followed. And most often we see that the athletes, when I tell about antioxidants, it's not that taking in a very large quantities, but taking the quantity that is needed and at the time where it is most important. Okay, so during the recovery phase, trying to feed some food products that will boost all this, and including carbohydrate in your drink. All these have multiple benefits, not just in restoring glycogen. Protein, as I already told you, is one of the key nutrients for immune building, and whenever you take protein, you should understand also that the muscle synthesis is enhanced up to 72 hours post exercise. So consuming at regular intervals, not consuming protein at one go, that is taking more than 30 grams during a particular time zone or time period, is not useful, because protein is not completely bioavailable or absorbed. At one particular time, your body can absorb only 20 to 25 grams of protein. So if you're giving an excess at one time, it might not be suitable. But you have the next 24 hours to refuel yourself. So at regular intervals, encouraging the athlete to eat high protein is useful. So this is the same thing. There's no benefit of consuming excess that is beyond 2.7 gram per kg body weight. There is always benefit in consuming a post-training 10 gram of essential amino acids. Particularly, 2 amino acids are useful for immune function and immune activity. That is, one is glutamine, which is a conditionally essential amino acids. It is an important nutrient for the immune cells. It helps in the gut barrier function. That means your GI tract or your gut is largest barrier for the entrance of infection. It creates a barrier. Okay, so this glutamine is a protein which can enhance the function of that barrier, and it also enhances glutathione production. As you all know, glutathione is it's an enzymatic antioxidant. It helps at the enzyme level to trigger free radicals and help in fighting oxidative stress. So because of that, it's important. Glutamine has had some importance in the literature, and they have suggested the use of glutamine to be useful for building immunity. Second is, of course, the branched chain amino acids. As you are aware, leucine, isoleucine, and valine are the 3 amino acids that are very useful. It stimulates protein synthesis, and it also activates cytokines and antioxidant production, which is useful for your immune function. But no strong evidence is there for supplementing these. It can be available, it is available through diet. So one thing you have to keep in mind is the protein quality. That is, animal versus plant proteins are usually debated. In terms of availability of protein, the animal or the dairy-based proteins are more readily available. It has the greatest anabolic effect and compared to plant protein. Okay, and this is the digestible indispensable amino acid score, which is the protein quality score. As you can see, most of the food products like cow milk and even a fish, tilapia, okay, chicken, all these have very good. Even non-animal derived sources can also be successfully incorporated in the diet. That is soy flour and also peas, cooked peas or rye, or rye and barley have relatively less, but if you look at peas, it has about 60%. That means 60%, if you consume 100%, out of which 60% would be utilized or available as a protein, or that's the basic meaning of it. The rapidly digested proteins that contain adequate leucine is also useful for stimulating the muscle protein synthesis. Food first approach is contested, and that is something that we have to keep in mind as nutritionists, because most often when we go to an athlete, they would require a supplement. First, always approach with food. If it is not working for any reason, for example, if he's training at very high intensity, he's not able to eat that much, is when you would think of a supplement, or he's having a deficiency, he's prone to some damage, or he's going through a clinical condition. In these cases, maybe, but food first approach should be applied. Unless you have a balanced diet charted for the athlete, supplement is only an add-on. Okay, you can't think that supplement is going to replace your balanced diet. Okay, so that is something that you also, as nutritionists, we should believe, and we should provide that, see the result. Okay, after a long time, like we need overtraining to improve performance, in nutrition also we need certain tweaks to improve the availability, because constantly when you're providing the same thing, your body is used to that, so you will add one component over the other. So beetroot juice is that one component you could add. Similarly, there are other food items, I would come to that. So fatty acids, particularly omega-3, is very, very useful for recovery and immunity. Now, polyphenols, as you all know, you're all nutrition students, I don't need to say, and I was so happy to see the diet chart where it contained a lot of chocolate and for recovery, right, particularly, and it is also a potent source of antioxidant, so this is useful. And research on muscle damage has used these supplements to understand whether these can have an influence on decreasing some of the muscle damage markers which I have stated, the delayed onset muscle fatigue itself, the markers of inflammation, and whether it improved muscle function. How they tested is by using the 1 repetition maximum of bench press. They saw if that athlete, after consuming any of these, showed an improvement in the performance outcome, that is muscle function, and also the decrease in health parameters, clinical parameters like muscle damage or inflammation. Most of the supplements, this was actually supplemented, but we could also use most of these, these are all extracts, fruit juices readily available among for us to use this for recovery during the recovery period as well, because it has shown to have a decrease in the delayed onset muscle fatigue and also improvement in the muscle function. Most of these vegetables and fruits are readily available and are encouraged to be used in quantities that, for example, 2 beetroots in 200 ml can be given for 200 ml. Similarly, watermelon, pineapple, pomegranate, these are all easily accessible. So you can develop an extract and a concentrate without adding, or if you want, you could add jaggery or honey, but without adding sugar itself. Also, it can be readily consumed. Even ginger and turmeric. Okay, so curcumin, as I already saw, we also recommend it during the bedtime period for recovery, and this has a role in decreasing your muscle damage and muscle stress. So these things are something that you could think of in including the diet plans or charts of athletes, particularly those who are training at a very high intensity level and whose training protocols have a lot of heavy training involved, or those who are endurance athletes. So even flavonoids, of course, are part of polyphenolic compounds only, and these are all very, very important for your recovery as such. That is your tea, chocolate, berries, like fermented and fermented products are also useful. The flavonoid supplementation has ranged from 0.2 to 1.2 gram per day across 14 studies that have been selected in this review, and they found that all these were useful in reducing the upper respiratory tract infection. So any of these ranges were most useful for the reduction of that. And flavonoids are also very useful because they have antiviral effects, so that's something that we need to know. And they can modulate natural killer cell activity. So they can regulate T cell properties and influence inflammatory responses. So macrophage inflammatory responses are also regulated by these flavonoids. So encourage all of you to keep a variety of these in your diet, because as you can see, some products are anti-inflammatory, some are antioxidant. Try to make a mix of different food sources so that you get both the kind of benefit and not just follow the same protocol across a weekly schedule or a daily schedule. Second aspect is probiotics. We all know its effect on general health and well-being, and it also has a role for immunity. That is, it will help you tolerate the microorganisms and slowly fight it, rather than having a very strong opposition or reaction at the first instance. That will quickly reduce all your resistance. Okay, so if you resist things that are not needed to be resisted, in the process you might also kill the good bacteria that is available for you, right? So the probiotics can be useful even at the athletes, for the athletes very particularly. So encouraging them to include curds, yogurts, fermented vegetables, that is sauerkraut, and fermented tea is also encouraged. So all these can be included as good sources for recovery from muscle damage, as well as for improving your immunity. So there are two things that happen for recovery when you take these kind of foods or include them in your diet. The nutrients of interest like vitamin C, I'm not going to go in depth because these are nutritionists, so I'm sure all of you know this. Recommendations now as per the present RDA is 80 mg per day for adult male and 65 for female. And food sources, as we all know, is readily available, and it's important to include them, like guava or gooseberry. Citrus fruits in general have greater than 50 mg of vitamin C. So we can easily get this from food, and there's no requirement for supplements. It has been shown to build immunotolerance by preventing upper respiratory tract infections. Intakes of 0.25, that means you should see that only 80 mg is the recommended dose, but when there is a high intake of 0.25 to 1 gram per day has shown a 50% decrease in the upper respiratory tract infections. The position statement of the Society of Immunonutrition is what has quoted this, where they have found that if an athlete, like one question one student had asked, if an athlete is having COVID, how different should be a nutrition protocol for them? So the institute, the Society of Immunonutrition has given a position statement where they stated that if any individual is going through COVID or going through an intense infection, naturally their recommendations for these nutrients don't stick to the normal levels. It needs to be increased, and it can go up to 1 gram per day Okay, so that is particularly normal if they are undergoing a COVID situation. So it's okay to increase a dose. It's okay to provide a supplement when that person is undergoing a severe respiratory infection, or increase the dose. So higher doses after onset of upper respiratory tract infection can reduce inflammatory response and reduce the infection duration. So this has been provided by the International Society for Immunonutrition. Further, even considering vitamin E, similar recommendations have been given, 15 mg per day. The upper limit is 1000 mg. So its toxicity happens only after consuming 1000 mg or beyond that. Food sources include pista. So I know 100 grams we don't consume. We might consume 20 grams maximum. But try to consume variety of foods. Include seafood on your daily diet. And it is shown to have an improved in vivo immunity and reduced upper respiratory infections. So high doses, okay, beyond 1000 mg can act as pro-oxidative, which is not good. So if any of your athletes are using supplements, it's important to monitor their intake. If it is very high dose, it's not going to be useful. Zinc requirements. Zinc is a very potent antiviral agent, and it helps in release of interferons, which directly acts on virus. Okay, so interferons are machineries produced within our body or immune cells, which fight against virus. So that's also one reason that zinc is a useful nutrient to consume in adequate quantities. Now, most of your zinc, like a higher quantity among cereals, is found in quinoa, ragi, and wheat flour. Among pulses, you have cowpea, Bengal gram, and horse gram. But the real high quantities are found in oysters and crabs, and even animal meats have around 1 to 4. It's a range. So these need to be consumed per 100 grams. Okay, so based on your quantity, you need to fix. Another nutrient that has a positive influence on the signaling pathway to build immunity. Okay, it might not have been associated earlier with immunity, but when Madam was saying about vitamin D deficiency, of course, it also has a role, or it has a signal towards building immunity as well. So that also needs, because it helps in tolerating that infection, and it also that's how it helps us. The requirement is 15 micrograms per day or 600 IU as per the RDI-ICMR 2020, and the food sources are actually more than food sources. Sunlight is the most useful and readily available source. It readily transmits or makes vitamin D available for the body for absorption and bioavailability. However, if somebody is not, like in situations where we are home quarantine or lockdown, food sources are also encouraged. Okay, if the person is not on any deficiency, quinoa has a very good source of vitamin D. It's around 40 micrograms. Soybean, oyster mushrooms around 100. So even animal based, because animal based has vitamin D3, it can be easily or readily available in the body, because some amount of plant-based vitamin D is not absorbed or is not available. So if you say 40 micrograms, that might not be the, one entire thing might not be available in the body. So you might have to consume a higher quantity to probably get it, right? But in case of animal foods, it's more bioavailable than the plant-based approaches. Another thought to leave you is, whenever there is a free radical that is formed, of course, your vitamin. Yes.
I'm so sorry to interrupt, but we're just running a little behind the time. So
Right,
if I
done.
request you
I'm
to
done in 2 slides. I'm done. Yeah. So whenever there is a free radical that is produced, it gets attached to vitamin E. That is alpha tocopherol, which gets oxidized to the tocotrienol. Now, this is itself is a highly reactive compound or radical, which needs to be reduced again. For that, you need vitamin C. I know it's a busy cycle, but what I wanted to communicate here is that all these nutrients are interlinked. If you take vitamin E in excess, it's not going to give you an added benefit. But in your diet, it's important to give equal proportion of vitamin E as per the requirement, vitamin C, and also glutathione iron, particularly you can consume glutamine and other essential proteins that are needed. So protein, vitamin C, E, all these need to go hand in hand. Consuming everything on a daily basis based on the requirement is important. Now, as I mentioned about the risk factors, particularly if an athlete or if there's a winter season, it's important to focus on these nutrients. Some of the nutrients for focus, okay? So if somebody suffering from upper respiratory tract infections, zinc and vitamin C are things to focus. If an athlete is traveling constantly, probiotics are important. If the athlete is in an energy deficit state or in a low carbohydrate state, or when there is training, these vitamins, minerals, and probiotics are useful. So, as per the risk factor for illness, these are the nutrients that can be beneficial. So, nutrition protocol needs to be in place for recovery across a year, across a training cycle based on the training schedule. And nutrients should not be considered in isolation, should be consumed in combination. Food choices are better than supplements. Supplements are any products that are sold in capsule or powder form, and it's only required when there is infections, clinical deficiency, or while on a low calorie diet. Exogenous antioxidant intake should be from fruits, vegetables, nuts, and seeds, and supplementation is not required. If you're an endurance athlete, you need to have a caution when you take antioxidant supplements, because the more is not better for them, because they might lose on their training adaptation there. So it's okay to consume the required amounts as per the RDA, but not beyond that. Micronutrients of interest, as I already told. So thank you all for your patient listening and welcome your questions. I am from the Maya Sen Department of Sports Science. And who are we? We are academicians. We run the MSc Sports Nutrition program. We are also researchers. Personally, we can say, we are in the starting phase. We've stepped into personalized nutrition and some concepts of REDS. This is my contact details, and thank you once again. You could contact me anytime for any doubts, and I would be very happy to interact with all of you.
Indeed, a very informative session from our end. I think summing up this entirely extensive and very detailed information would be a little difficult, but it was a smooth transition from letting us know what exactly recovery means, what are the biochemical changes that the body would face, and then I'm actually looking at the nutrition that would really target the biochemical level of the body, So it was just not generalized, it was very specific. So I think that was something that the students will really benefit. Thank you so much. And it was really coming from a nutritionist's point of view, because we were not only talking about the nutrients, but we were talking about the quantity, the quality, the safe measurements. So I think it was all covered in a nutshell. Thank you so much again for such a wonderful presentation that you gave us. I would just like to pose some questions that we have from the participants. One of the participants would like to know, how can we check if the recovery is done properly or not?
In which in general, in the training setting, they test if an athlete is going through fatigue. That is by just asking them questions related to these are general questionnaires that are available. Even I could pass on some if through mail. Maybe I can contact with madam and give you some questionnaires which will talk about the mental effort or their sense of effort or their perceived effort. For example, if I ask all those who are studying or students, are you stressed about exams? Some of them might be really stressed. That means they are more thinking about exam and they're more stressed, right? So that itself triggers some kind of a higher response, and it could increase their duration for recovery. That means they would take more time to recover. Same way for an athlete, if they are saying that they are not able to perform that well, okay, basically first and foremost we take their opinion. Okay, what are they feeling? Are they feeling good about themselves? Are they fit? Are they feeling? So there are a list of questions. Probably we can interact with them and find out. Second to that, if they say that they have all these problems and they are not to train, they are not able to perform, they are going through a depressive state, second most will be to test some of the blood parameters, especially if you feel that if he's a strength training athlete, it might be related to muscle pain or soreness. We ask them if there are any of the symptoms of any overtraining syndrome. Like we also find out if they're sleeping well, if they're eating well, if their recovery is well, they're having any problems in, you know, their personal life. So these are some questions around this could also be related to their rate of recovery, whether they can recover faster, or if they are having any symptoms, physical or biochemically. We can also estimate some of the markers, like I already said, creatine kinase or lactate dehydrogenase, to understand specifically if they have any muscle damage involved during, or muscle soreness that will create some kind of swelling. Then they need medical attention, and we could, you know, provide them with some recovery strategy, heat pads, cold pads, and things like that. Yeah.
So can we say there is a standardized questionnaire that is available, or we may probably make it specific to the person we are addressing to?
So, you know, understand it's actually a very interesting question, because till date, even in research, the difference between functional and non-functional overtraining syndrome has not been clearly delineated. Okay, somebody who's functional and non-functional, it's a very small margin. But right now, the ECSS, the European College of Sports Science, and some other position statements are present, you know, where they are research is still, you know, trying to understand the best biomarker for peripheral fatigue, or, you know, they are still exploring, though there are some, of course, as I've stated, the muscle damage marker. But if you look at a questionnaire-based model, there are some questions that need to be involved, and I think I have a hand of that questionnaire, and I could probably share it with your faculty, right? And it can be specific, because see, culturally specific, yes, some questions might be more relevant, and maybe we might have to translate that questionnaire to the specific academy or sports fraternity that we would be catering to. But the basic gist of that questionnaire might be suitable. Okay, the way we ask the question might differ, because a stressor is same a stressor for Indians, right? So that kind of variation will be there in our approach of questioning, but the questionnaire content will remain the same and can be used, and will be standardized.
Okay, thank you so much, ma'am. The next question we have is, are there certain supplements that would help when taken only during the competition?
Supplements are a very, tricky state. See, I can't just recommend something just like that. Generally, there are no supplements that is going to give you a performance advantage more than the balanced diet. Supplements is more like when they're traveling, when they're going abroad, they don't have enough means to consume a normal diet. That will lead them to have a stress that the other athlete might be benefiting. It's more of a psychological change that they depend on supplement. You know, this was with one of my interactions with the hockey captain then in 2016. What he said is, I don't need to take supplements, but I'm taking because my colleagues or my other counterparts are taking. It leaves a stress on me that why am I not taking it? Okay. So it's not needed in your diet. It's just also more of a placebo kind of effect that you will have with supplement. But like you said, if the athlete is going for competitions, he is not able to consume enough food, then a good protein supplement is definitely useful. Not recommended, but may be useful in case he is not able to consume food, or due to change in location, and also good source vitamins and minerals in terms of fruits and vegetables. So consuming that is very, very important.
Okay, so we also have a psychological aspect when it comes to supplements, I guess.
Actually, psychological aspect is more.
Yeah.
Okay. Once we follow the balanced diet, generally you will see an improvement. Okay. Even with food, we can tweak. Like recovery can be tweaked with some food, some fruits that might add on. But taking a supplement is like, oh, I took this, so I will get some performance benefit.
Right. Another question we have is, will the nutritional weight management in athletes interrupt the recovery process?
Weight management, okay. It should not, because see, how do you calculate calorie? You calculate calorie based on his training intensity
Right.
Okay, you try to understand how much energy is expended during training. You include his RMR, how much of resting energy expenditure he's having, and in some instances you might add on to that the thermic effect. If you say a 3000 calorie diet, the thermic effect of food is 8 to 10%. So it does not exceed around 300 to 600 calories or maximum 300 calories.
True.
10% means 300 calories. So that is not going to make a major difference in his total energy expenditure. But the training is the most varying component. So it's important for you to understand, okay, if he's training and he for his training he needs 1500 calories over and above his for example his RMR is say 1500, which is way high for an athlete, generally does not happen. The total energy is 3000. Then within that only you have to make sure that the recovery meal is covered perfectly. Okay, it's okay if he eats his lunch a little less, but the recovery nutrition needs to be provided to the T because that is what will help him train the next day. So meals are like in terms of meals, recovery should be given more priority if he is in a heavy exertion or intense training situation.
Okay. I think the answer to this question is exactly what the next question is also asking, that if an athlete burns around 3000 calories per day, then how much more calorie intake should be done so that there is a better recovery taking place. I think somewhat it's been
So it's
answered.
not adding, yeah, yeah. So it's not adding on to the calorie. It's actually setting the calorie based on that individual's training, and
Right.
then within that, making sure that you're meeting the recovery nutrition.
Okay, I think we've cleared much of the questions that we had from the participants. Thank you so much once again, Dr. Karen, for such an informative session and for all the expertise that you gave to the participants. Thank you so much.
Thank you so much for the invite, and I'm glad that it was useful.
Thank you. Moving on, I think we are in the last part of the session where I would not really like to wind up the session before giving a vote of thanks. So it would give me a great privilege to propose the vote of thanks for this occasion. Allow me to please take the last 5 minutes of your time to thank all the team members because of whom and because of whose effort we were able to make this occasion possible. I would like to thank our eminent speakers, Ms. Sushmita Jyotsi and Dr. Karen Cherian, for their time and expertise. My sincere gratitude to our principal ma'am, Dr. Professor Mala Pandurang, for her support, and not only for this event but throughout whichever event we have, she's always been a support to us. A special thanks to the entire management team of Seva Mandal Education Society for their constant support and encouragement. Thank you, Mrs. Anuradha Shekhar ma'am, our vice principal, for being a strong pillar for us. And talking about a strong pillar, we definitely have Dr. Rupali Sen Gupta, who's the head of department for the team, and she's a strong pillar not only for the department, not only for the webinar, but throughout to the students and to the teachers. A very special thank to Mr. Nitin Pawar sir and Ms. Sharda Sirsila ma'am for helping us with all the technical support from the computer applications department. I would like to extend my warm gratitude to a team of very young people whom we call the webinar team. It would, which is made up of all our students. So it's Miss Riddhi Shah, Miss Reena Popnani, Miss Khyati Salotra coming from MSc CND second year, and Miss Tanvi Gala, Miss Bhumi Bhanushali, Miss Heenal Sayyed, and Miss Dhwani Desai from the PGSSFN batch. Thank you so much to all the students for making this possible. I guess only thinking about the idea was what the teachers actually did, and then the entire implementation process was done by the students. So thank you and hats off. And obviously, thank you so much to all my colleagues, Ms. Sonu Mishra and Dr. Lakshmi Menon, for always being there. I would like to thank all the participants for all the patient listening that we had, and I hope that the webinar must have added to your knowledge. I would just like to inform you all that the link for the feedback form will be posted in the YouTube chat box, so you can take the link from there and please kindly fill up the feedback form. Thank you so much. Stay safe, stay healthy. I would like to officially conclude the webinar. Thank you so much.